person or online. We do have folks on the line, and we will try to bring them into the conversation in a really full and meaningful way. I'll be monitoring the chat. For those online, I do encourage you at any time to unmute, and please feel free to jump into the conversation. For those in the room, we want you to join in the conversation as well. For everyone, if you're not actively speaking, if you could please keep yourselves on mute, whether you're in the room or online, that will help to provide a positive listening experience for everyone involved. My name is Amy St. Peter. I'm the Deputy Executive Director here at the Maricopa Association of Governments and one of the partners on this project. I'll cover a few housekeeping items and then turn it over to Todd Morris, who's the lead on this project, to offer a more extended welcome and to proceed with background about the project and introductions. In terms of housekeeping, the microphones are on when the light is green. You do need to push where it says push on the microphone. If the green light is not actively lit, that means that your microphone is not on and people online cannot hear you. So please do use a microphone. Even though your voice might carry, we do need that microphone to access the system. If you need restrooms, the women's restrooms are out the door to the left. Obviously, this is for people online, or sorry, in the room, not online. Online, you're on your own. So women's restroom is through the left door. Men's restroom is all the way down the hall through the right door. Please do feel free to take breaks. We do have some scheduled, but you're adults. If you need to step out, we trust you to come back and hope that you will do so. Please do make sure that your cell phones are on silent, vibrate, otherwise do not disturb. Again, just want to create a positive listening experience for everyone involved. We are recording this session, so just want to let you know that. We trust that you won't be saying anything too embarrassing. And two, it means that we can then share the recording with others who wanted to be here, but maybe weren't able to join. For those in the room, the folks who are online have their name tags, their name tags up at the front of the room, and we hope that they'll be joining in with the conversation as well. We do have breakfast available in the room over to your left, just behind you there. Please do feel free to grab some breakfast. We'll have that available throughout the day. We'll also have lunch coming in, and we look forward to being able to share a meal with you as well as the discussion today. Any questions about the room or logistics from folks on the line or in the room? Okay, excellent. It's my pleasure now to introduce Todd Morris. He's been the lead on this project, and he will bring us into the formal part of the agenda today. Thank you.
All right. Thank you, Amy. Good morning, everybody. Todd Morris. I'm a transportation planner with Northern Arizona Council of Governments up in Northern Arizona. Special thanks to MAG for offering us this great, incredible meeting space. I think that when we were kind of envisioning how we wanted this day to go and kind of set the stage for the different type of workshops that we'll be having in the afternoon, this type of workspace is perfect. So thank you all for coming. Thanks, MAG for hosting. So throughout the kind of day, I do want to also introduce some of the other kind of co-leads on this project. Eric Lang with N-CATT, as well as Andrew Carpenter. They both are from the National Center for Applied Transit Technology, an extension of CTAA. And they have been very instrumental in helping us kind of guide this healthcare transportation workshop. And so I'll give them a chance to introduce themselves and a little bit more background on N-CATT in a moment. But I do want to kind of just set the stage for why you all are here. I know that I've reached out to many of you over the phone, or other members of kind of the planning team has. But I think that we're all here because of, let's see if this works. Maybe not. Drum roll. Well, it was going to be a big, yeah. Interesting. Anyway, we're here because we want to talk about rural healthcare access, and actually healthcare access in general across Arizona. And so here we go. This is I joke that every PowerPoint I ever make from here on out that's talking about rural Arizona or Northern Arizona, I'm going to find a way to include this because I just think it's so eye-opening in terms of the need for access to healthcare. And so this map here, the darker it shows, that's the larger the population, and essentially it's charted to show those living more than 30 minutes away from a hospital. And so this is a map was originally generated back in 2020 as a result of kind of COVID-19 and some of the impacts that it was facing on the Navajo Nation. But I think it's pretty eye-opening in across the state. I think a lot of the geography makes sense in terms of those that are familiar with Arizona's kind of rural areas. But those numbers on that chart, I think, also speak volumes in terms of the number of people that live further than 30 minutes from a hospital. You can see there we're up there with Florida and California in terms of total population, and then seniors, which I think is a heavy focus on a lot of the work that we do from a transportation standpoint as well. And so I think that this is sort of, if I were to try to frame this slide as in today's context, I'd say this is the problem statement. Is that there's a great need out there, and I think that even if you look at some of those pockets that are not shaded, in looking in kind of the Tucson, Phoenix, Flagstaff area, I think that we all know that healthcare access, even in those locations, isn't there's opportunities to improve there as well. And so anyway, I think I'll probably find an excuse to show this map again, because I really think it frames my role as a transportation planner and the challenges facing Arizona rather well. So with that, the next slide here is kind of how that's the problem statement, what we are trying to accomplish within this technology summit. Many of you did attend a webinar with us on March 28th. This was an all-day webinar where we did hear from transportation providers from across the nation and healthcare providers that were kind of working together to try to address healthcare access. The intention with that was to sort of kind of spur some ideas on how we could look at initiating some projects to help address that map on the previous slide. We then also kind of extended that conversation to the Arizona Transit Association conference, where I know we kind of continued to recruit some individuals. And then here we are on the May 9th in-person workshop, where we're hoping today to kind of maybe dive in a little bit deeper to some of the topics that we have introduced. I think that we learned an awful lot from that initial webinar and presentation at the ASTA conference. And I think that the biggest thing that we learned from that is we learned all your names to try to recruit you to come to this session. So I think that just within those first two sessions, we found tremendous connections, and I think that that's definitely something that we're hearing in reaching out to all of you, is we're all trying to solve similar problems. And so again, I think that's why we're real excited for today's discussion, where we do hope to dive in a little bit more in depth into some of the potential topics and solutions that we're looking at, as well as just continue to kind of learn from each other. And so that's kind of the long extended introduction for the day. And I do want to turn it over quickly to introduce the N-CATT team, and then we do want to hear from all you guys on a kind of round of introductions. So I'll hand it to Eric.
All right. Hello, everyone. So I am Andrew Carpenter. I'm the director of the National Center for Applied Transit Technology. I'll wave. I don't know where the cameras are really, but that's me. And so, N-CATT is a technical assistance center funded by the Federal Transit Administration. So we work on behalf of the FTA to help small urban, rural, and tribal transit agencies understand how they can accomplish different goals or address different challenges that they have using new and emerging technologies, and also some more fundamental ones. So our work ranges from helping small agencies go from pen and paper dispatching of their buses to something a little more digital, to helping out with fare payment technologies, to also work like this, where it's a more statewide or regional effort to address bigger, thornier issues, such as getting to healthcare. And there's a lot of great stuff going on in the world of technology. So we want to help transit agencies harness what's out there and get a little bit further along in accomplishing working on their goals. So that's what we do. I'm Andrew, I'm the director, and Eric is also with me.
Hi, everyone. My name is Eric Lang. It's nice to meet you. I, of course, work with N-CATT. And just one sentence on that as well. I'd say for all of you in this room, just look at us as a resource. We were lucky enough to kind of join and support the work here. But when this ends, at least for us, is continue on for you into the future. You should keep tabs of N-CATT. Feel free to reach out to us with questions. When I kind of joined N-CATT, I learned that there's a great network through N-CATT, through CTAA, and other kind of entities similar to us. So if we can't directly help you, we probably know people who can. So feel free to just keep our emails, keep reaching out to us. I enjoy following along with efforts like this to see kind of how it progresses. So at the very least, I like to hear kind of what's happening down the road.
So again, NACOG and Age-Friendly Arizona, which is an extension of MAG, which I think will provide a little bit more information here in a second on. We reached out to N-CATT as a way of, we felt like there's a lot of different moving pieces around this topic of healthcare access. Wanted to bring in some national expertise. We also, the way they framed a grant opportunity for technical assistance was for them to come in and help kind of facilitate a summit. Which we really like the name Summit. And so, it's really exciting way of saying, series of meetings, but we're excited. And so anyway, as extending on the slide above, the Shark Tank style presentation is kind of the area that we are hopefully working towards, that we are hoping that in June, and I think we're kind of being a little flexible on the dates right now, is what we're hoping to do is, as a product of today's discussions, is we have some ideas, some concepts, or some kind of prototypes for various pilots that we then want to utilize kind of the network that we've created to bring in some potential, a variety of, we'll call it funders, resources. There we go. And kind of a stakeholder group that could help sort of fine tune those prototypes, those pilots towards the end. And so that's kind of our vision for the June Shark Tank style presentations, as you see there. We also are kind of recognizing that the opportunity to bring in larger groups like we're doing here, that may be a product that we turn to for that third day as well. So we're kind of keeping that open, but that is definitely the vision that we're hoping to work towards the end of the day. So is there any questions as a whole on kind of where we're at in terms of what you've heard so far? And if not, I do think that I'd love to hear from you all and do a round of introductions. And so if you would just state your name, your organization, and then, perhaps why you're here or some goals that you're hoping to get out of this session. And I'll just turn immediately to Amy if you want to kick things off.
Excellent. Thank you. Again, my name is Amy St. Peter. I work here with the Maricopa Association of Governments and help to staff Age-Friendly Arizona. And my goal for the day is to better understand what are our best opportunities, particularly given all of the great work that's already underway. How can we create some kind of value add to those efforts, and how can we support, amplify, and then possibly find some new areas where we can work together? So we have some ideas on that, but really we're here to hear your ideas. So I encourage you to let us know throughout the day. We'll proceed with Genesis.
Good morning, Genesis Verduzco. I'm with Equality Health. My goal for today is just learn a little bit more how we can better serve our community and, with transportation wise, especially specifically for those in the rural areas. So looking forward to future partnerships.
And I'm Maria Rebozo Lapine. I'm the Cultural Care Manager for Equality Health as well. So we're co-workers. So my job at Equality Health is to provide cultural care trainings to our providers and their staff so that they can incorporate culture into their care. So you have social determinants of healthcare and you have the cultural component here. We are in Northern Arizona as well. So I am here to see how we can help a community that needs a lot of resources, providers that really need to understand the Hopi and the Navajo culture so that they can incorporate that into their care. Thank you.
I'm Carrie Straub. I'm the Assistant Director of the Yavapai County Free Library District, and we're exploring the possibility of a new branch library that would focus on telemedicine in partnership with the Verde Valley Caregivers Coalition.
My name is Jane Lang. I wrote into law the first medical requirements for drivers in Arizona, and I work closely with the National Highway Traffic Safety Administration on older driver issues. And I also started the first older adult program at the Arizona Department of Health Services.
All right. My name is Jason Sneed. I'm with the Arizona Developmental Disabilities Planning Council. It's a mouthful. It's a federally funded organization that is one of us in every state. We work with states and different government entities to fund programs, also to just be a voice for people with developmental disabilities. Before that, I went to law school and I specialized in ADA compliance types of things. Did some work in Houston as well around transportation. So anyway, that's who I am. So
good morning. My name's Janet Major, and I am the Associate Director for Innovation and Digital Health for the Arizona Telemedicine Program. Our program here in Arizona is 25 years old. It's just like a dinosaur in the telemedicine world. And I've had the pleasure and honor of providing technical support as well as future planning for integrating technology to prevent transportation. I guess I'm here as a prevention advocate because honestly, to help solve some of the challenges that we have really can involve taking people to the closest telehealth access point and honestly finding ways to keep them in their own community, which also supports our economy. And it's where people really honestly want to have healthcare delivered. So we can maximize the resources we have here in the 6th largest state, and that's why we're 25 years old. We've also served as a telehealth resource center as part of a national consortium so that folks who do have experience can, in an unbiased way, promote the growth of telehealth and access to technology in communities without any type of financial obligation, much like the broadband planning grants, right? You know, to be able to talk to people in an open way without recommending specific technologies and coming up with solution, much like you're doing here, brainstorming the possibilities. So I have great resources that I brought to share. I'm also here, I'm 2 other people. I am both Mala and Aaron from the Arizona State Library. We have a telehealth and libraries project that we've been working on for quite some time. And there are actually 19 states nationally that have telehealth and library projects, which are amazing. Our libraries are amazing spaces. They have, often they're connected to a community garden. There are libraries of things. So I would like to share more information later about that telehealth and libraries project. And of course, I've got a great flyer on that too. So I'm very happy to be here in person to talk about things that we really have in common with regards to coming up with solutions for giving people access to healthcare. Thank you.
Good morning, everyone. My name is Mauricio Orozco. I am the Community Engagement Manager for Care First Health Plan. We're one of the access health plans here in Arizona. And I'm very proud to say that we've been in Arizona for 20 years. Not too many people know that. So currently, we're just serving the northern part of Arizona. We started doing that back in 2018. And then in 2020, we also became the REBA up in northern Arizona. We look at transportation not only as access to healthcare, but it's also, as it was mentioned before, as a social determinant of health. Usually when we look at social determinants of health, transportation is probably in the top 3 or 5, depending on where you're at, as far as the impact that it has on the community. And I feel very lucky to be in a department that really focuses on those barriers for our members that are outside of the doctor's office. So we work a lot with community-based organizations, the libraries, with Unite Us. We kind of just connect the dots in providing education and resources for our members so they can have access to those resources so they can really start focusing on their health. So I'm very happy to be here. Looking forward to connecting more dots. That's what I call myself, a dot connector. So thanks for having us here.
Hello, good morning, everyone. My name is Vince Torres. I am the Associate Director of Customer and Community Success with Unite Us. For those of you who might not be familiar with Unite Us, we're fairly new in the state of Arizona, although we have representation in 44 states across the country. We were founded in 2013 by a couple of veterans who came back to civilian lifestyle and found that it was very difficult for them to access quality or healthcare in general or support services, social services. So what we do is we're a web-based platform that seeks to do intense care coordination throughout health and social services. When we ask ourselves, what does health or healthcare look like? Sometimes maybe the community goes to, it's a doctor, a physician, an urgent care, hospital, what have you, brick and mortar, right? So what we are seeking to do is shift that a little bit, and we feel like health is in the community. So we look at, as I've heard colleagues say, social determinants of health. That all impacts one's lifestyle, their health and well-being. So in this summit, that what I'm seeking, my goal is transportation is a key component to this. How do you get to work? How do you get to your doctor's visits? How do you seek care, quality care? Let's just not go to care. But so we're looking at all of that. And our platform is web-based. We already are immersed in Arizona. We're launching. We have over 200 organizations, CBOs, community-based organizations, and non-CBOs, which are more like local county health, state health departments. So they're more around the convener role of bringing those in. So we are really focused, hyper focused on Arizona and working with the Department of Corrections, ADHS. Access is one of our main funders. And our community cares program is fully funded by Access. So that is all of the community-based organizations in Arizona are already eligible. So we and my team are really just really determined to do the outreach, awareness, the training that is needed for these organizations to just onboard to the platform. So our goal is really just to connect communities and work with them and help them address the complex needs of child, individual, family support.
Good morning. I'm Jen O'Connor. I'm the planning director for Northern Arizona Council of Governments. So Todd and I work together. As a council of governments, our member organizations are our local jurisdictions across 4 counties in Northern Arizona, Yavapai, Coconino, Navajo, and Apache counties. And we also work very closely with the nonprofits in Northern Arizona who provide healthcare and transportation services to older adults and people with disabilities. And so I work more on the roadway infrastructure side at this point. Todd is certainly our in-house expert on mobility and transit and getting people where they need to go. But just excited to be here today and learn from everyone. So thanks.
Hi, I'm Pam Wagner, and I work with Resound Networks as their Director of Community Outreach. And Resound Networks is an ISP. We provide internet, and you may ask, why are you here? And I was talking to your NTIA officer, Nicole, and she just thought it'd be a good place for me to come and learn more about Arizona and where the needs are. We have been awarded quite a large FCC contract through the RDOF reverse auction. So we're coming and we are funded, and we want to make sure as we deploy that we are deploying to the right areas, the people who actually need it. We are basically a rural internet company. We do not do the large cities. And so this helps me understand, yes, we may have plans, but those plans can shift easily with one conversation, or we can include things that weren't included. I just need to know where you need us. So we're excited to come. We have, we're going to work in 8 counties in Arizona. 3 of them will be in the northern, and then of course, Maricopa itself, we have about $16 million. A quarter of that will be in Maricopa County itself. Thank you.
Is that better?
Yes.
I'm Mary Jane Beeson. I'm representing Chris Hansen, who's going to be here a little bit late. Chris is our local Arizona leader doing business development for Humana. But I want to tell you just a little bit about Humana, since you may, I don't want to assume how much you know about us. We are in Arizona. We have 225,000 members in Arizona, and they're primarily on Medicare. So we're already here. We've got 9 CenterWell centers, primary care centers for seniors. If you've ever had a chance to tour them, I welcome you to stop by. I've been to a number of our CenterWell centers throughout the country, and they really are the best thing for a senior, particularly seniors that might have issues with social determinants of health, issues with behavioral health, as well as physical health, issues with, their medications. And seniors have a lot of medications. I have a 90-year-old father, and when I look at his pill box, it makes me freak out. And I'll just say this, we do employ 2,600 Arizonians, and really proud to be in your state. I'd also say that we have a very large pharmacy distribution center for our company nationally in the state. So we have a lot of real estate. We believe in Arizona. We think that Humana can be a part of a solution for seniors as the state takes on more and more senior citizens. We also have contracts with physicians where we pay them more when they provide better care for you. So your doctor's happy, we're happy, and you as the member, when you're in our plan, are happy. That's just a little bit about Humana. Thank you for the opportunity to be here today, and you'll meet Chris later when she's here in just about an hour. Thank you.
Good morning. My name is Eric Barr. I'm the CEO of Elaine. We're a local nonprofit providing no-cost transportation for individuals experiencing homelessness and also other vulnerable communities to access critical resources and services around social determinants of health locations. So we will take people to healthcare appointments, food access, housing, job interviews, laundromat, really anywhere critical that they need to get access to. We'll help provide that at no cost to them. And we have 5 vehicles and drivers now, so a little bit of a smaller operation, but our vision is to grow into a national provider of transportation services.
All right. Hi, everybody. Andrew Renda. I'm also from Humana. I work with Mary Jane. I'm the Vice President of Population Health for Humana Healthy Horizons. And when we think about population health, we take a holistic model. We think about physical health, mental health, and social health. Within social health, kind of somebody over there said top 3 or 4. Think about food insecurity, transportation insecurity, and housing insecurity are probably our top 3. Maybe just beyond that, loneliness and social isolation and financial strain. So those are kind of our top 5. When I think about transportation, something else I heard over there resonates. I think, we need to open the aperture a little bit more and call it an access strategy, access to care. Access to care can be helping somebody with transportation to get to a healthcare facility. It can be bringing healthcare providers to that person in their community, in their home, or it can be providing virtual care. So if we go a little bit broader and think access, I think, we need to figure out what people want, what people need, and what's going to best sort of serve their healthcare needs. So thanks for having me.
Good morning. My name is Nathan Adson. I'm the Telemedicine Services Coordinator for Tuba City Regional Healthcare Corporation on the Navajo Reservation. I took the position about 3 years ago. I started off in technology, but our goal at Tuba City right now is to find a mobile unit that we could use to, provide our care to rural areas around our community. Right now, we have our community counseling center department that has 2 mobile units that they use, and they go out and provide, they provide that healthcare to, people out in our local communities. But with our telemedicine department, we were working with the FCC recently. We were awarded, and our goal was to use those funds to purchase a mobile unit, but at the 11th hour, they told us that it wasn't an eligible expense. So we lost out on that. But here today, this is my first time participating in something like this. Just want to learn more about the program, what it has to offer, and how I can go about getting my department going with something like that down the road in the future. So happy to be here.
Good morning. I'm Deborah Martell, Division Vice President for Provider Network Growth and Development for Dignity Health. We have 2 acute hospitals in Northern Arizona and Yavapai County with nearly 400 physicians on staff. We have almost 200 employed physicians in the primary care and specialty arena, and 20 specialty locations and 5 primary care locations in Yavapai County. Really, I was not participating in the first conference, but glad I was able to connect with you all today. Just want to understand how we can partner with the agencies in this room to bring quality healthcare services to the rural communities in Northern Arizona, whether that be bricks and mortar or virtual care or other means of access. So really, thank you for having me today and look forward to the conversation.
Yes, good morning, everybody. My name is Ryan Fraley, and I work for a company called Khajiit, I would imagine it's maybe not something you guys are familiar with. We are a managed IoT services provider, been in business for about 20 years. Really, we are a connectivity company is kind of the best way I like to put it. We work very closely in K-12 as well as higher ed. We are in healthcare, public transportation, public sector, really making connections for good. So for example, during the pandemic, when all the schools shut down, we're helping schools and provide connectivity solutions for students that maybe are going home expected to do virtual learning, but don't have access to cable internet or access to online resources while at home. So Todd asked that I join today, and I'm happy to be here. I think it'd be great to learn a little bit more about some of the challenges, particularly from a connectivity standpoint, and see what Khajiit can do to kind of support some of those efforts, especially in our rural and tribal communities. So thank you.
Excellent. Thank you. Do you also want to acknowledge Hezekias over there on the keyboard? And he is a transportation planner with us in the Human Services Division and doing a great job. Didi Gastia, also in the audience. She is our program manager for Human Services Transportation, been with MAG for a long time, very active out in the community. And Mimi, she's our admin assistant in Human Services, and she keeps us running. So we appreciate everything that she does for us and all the details that she covers. It's my pleasure now to turn to those who are online, and I will call out your name. The list is mainly alphabetical according to first name. Every once in a while it throws in kind of a curveball with a last name going first. So Arun, would you like to introduce yourself, please?
Sure, Amy, thank you. And I'm very glad to be here. My name is Arun Arunachalam. I'm a solution architect working with Amazon Web Services. I work as part of the ASU Cloud Innovation Center. We do a lot of digital prototypes to especially bridge the communication gaps between the healthcare providers, the transportation service providers, and our seniors as well. So I'm very excited to be here and to listen to the challenges and how we can contribute. Thank you.
Thank you so much, Arun. We've been working with Arun and his team over at the Cloud Innovation Center for about a year or more, and we're excited to be able to share that work with you this afternoon. Another person is signed in as FJ Antone. I'm not sure who that is. Would you like to unmute and introduce yourself, please? Or not, that's okay too. Okay, we will come back. Jean, okay, that's somebody else with Khajiit. Jean, would you like to introduce yourself?
Yes, ma'am. Good morning. Gene Ballard, Director of Strategy with Khajiit, and I am here along with Ryan, who's there in the room. So apologize I couldn't be there in person, but happy to join you and learn more about what's happening in your state for sure.
Excellent.
Thanks
Thank
for
you
having me.
for joining us. Carmen, would you like to go next? Carmen, if you'd like to unmute and introduce yourself. Okay, moving on to Kent Ellsworth. Would you like to introduce yourself, Kent?
Yes, thank you, Amy. Thank you very much. First, I want to start by saying thank you to all of you who have worked so hard to put together this summit, Todd and Amy and others, and I really do appreciate all the work to help us stay moving forward. We've got to keep moving. And I'm the executive director at Verde Valley Caregivers Coalition. Our headquarters are in Sedona, Arizona, and we provide no-cost transportation to about 1,900 riders every year, almost all 65 and older, and they're unable to drive due to health conditions or advanced age. So the average age is about 80 years of age, and the big stress we've really experienced so much since COVID came around is access to healthcare. And part of that is the fact that a lot of healthcare providers have left the rural areas. We've actually lost 40% of our healthcare providers here in the Verde Valley area of Sedona, Sedona and the whole Verde Valley. And the other dynamic with that comes with that is the fact that we have to get people down to Phoenix. We get people to Prescott, to Dignity Health. We travel long distance trips for healthcare access about 26 to 30 times every week. Each day we dispatch approximately 30 vehicles on the road, mostly volunteers and 3 paid staff drivers. And the other part that we're doing now is virtual care assistance. It's just in its infancy, Just this past Friday, we were delivered 10 tablets from Northern Arizona Healthcare. And we have a team of 12 retired nurses and physicians who will go out to a person's home with the tablet, help them set that up. And we have those hotspots, so we can guarantee they can actually connect to a virtual care appointment from their home. And of course, we're looking forward to our work with the Yavapai libraries and being able to get people to a site for a virtual care suite where they can connect. So a part of this is making sure people can connect to all of those specialty providers. So that's our problem here. A lot of specialty providers have gone away. Northern Arizona Healthcare is trying desperately to get more specialty providers here, but a lot of them are locum tenens and are just here very temporarily. And when people want a cardiologist, they kind of want to see the same cardiologist over the next few years, rather than a different person each time to go in. So there's still a lot of stress and all of that. All of our drivers are volunteers. We have about 85 volunteer drivers and 3 full-time drivers on staff. We'll be driving about 550,000 miles this year. So that's a lot. And our goal is to make sure people are able to age in place. So just because all of this is going on, why should they be forced to move, leave their home, their community of choice, their friends? So it's so important, our work all together, all of us here. And I appreciate everything that you're doing. Thank you so much.
Thank you, Kent. Great to have you here. Miriam, would you like to introduce yourself next, please?
Good morning. I'm sorry I couldn't join you guys in person. Can you guys hear me?
Yes, ma'am.
Okay, perfect. Sorry I couldn't join you guys in person. We currently have cooties going through our house. We all caught COVID, but I am with AmeriCorps and AmeriCorps Seniors through Northern Arizona University as part of the Center for Service and Volunteerism office. We have been in service with the Senior Companion Program for over 38 years, providing free transportation to seniors 55 and over through our volunteer program. We provide transportation to and from anywhere a client would like to go, whether it be a health appointment, a senior center, some kind of social event. And we allow, as Ken was saying, people to age in place, stay in their homes longer, and provide social opportunities for them to, like I said, remain in their homes as long as they'd like. We currently serve 10 counties across the state. So we're all over Arizona. And we have about 1,471 people in service across the state, with over 284,000 hours of service and about 40,000 or so people that are providing support. We partner with over 300 partner agencies in our state and have been very blessed to have the opportunity to provide that stipend for our volunteers. So our volunteers receive a $4 stipend, and they do get mileage reimbursement as well. And then just depending on the area of the state that we serve, we do have 3 programs that we currently have. We have the RSVP program, which are focused on food insecurities. And the RSVP program is the largest volunteer network where you choose where you want to help. So in whatever capacity you'd like to help in. We have retired doctors, retired nurses, retired just people from all walks of life. In the foster grant program, we are providing one-on-one or group setting, mentoring, tutoring opportunities directly in the schools and or with partner agencies that serve children across the state. And then with that senior companion program, again, we have seniors 55 and over serving other seniors, currently trying to make connections or more connections in the veteran side of our service. because we currently have some veterans that would like to serve other veterans. Aside from that, all of our volunteers get put through a rigorous background check and are completely cleared before they work with anybody in our community. And I'm here to see how we can partner and engage in this council as best we can. You will see Deidre. She is my coworker, so she'll be popping in and out of the summit. And she's located out of Flagstaff. Thank you, guys.
Thank you, Miriam. Mitch, would you like to go next, please? Mitch, I think you're, oh, we can't hear you. Oh, sorry, still can't hear you, Mitch. Oh, there you go.
You can hear me now?
Yes, we can. Thank you.
Hi, I'm Mitch Reddy with, so I'm the Associate Transit Planner for Flagstaff Mountain Line, the public transportation agency in Flagstaff. I didn't have a lot prepared for today, but I'm happy to listen and learn, and yeah.
Perfect. That's why we're all here. Thank you for joining. Sam, would you like to go next?
Of course, thank you. So I am Sam Johnson with Elaine Transportation. Eric Barr, our CEO, is actually there in person representing today. I was really looking forward to being there myself, but I am also out sick, unfortunately. I do want to say thank you so much for hosting this summit. I think this is a wonderful, wonderful idea. And my goal for today is to get a better understanding of currently available resources for access to healthcare and SDOH, so that we can expand to fill the gaps. I truly believe that transportation is one of those rare fields of service where we can be more than the sum of our parts by working together.
Excellent. Thank you so much, Sam. Great to see you. Scott, would you like to introduce yourself, please?
Hi there, my name is Scott Howell. I'm an associate professor at AT Still University and the director of public health, dentistry and teledentistry. And I'm really here as a fly on the wall. I have no clue how this invitation ended up in my inbox, but I'm really interested in learning more about the social determinants of health and how they're impacting Arizonans. Most of my work is in medically underserved urban areas, and I'm trying to better understand the needs of rural areas. And telehealth, I think, plays an important role. But like I said, I'm more of a fly in the wall because I'm just curious to see what's being discussed in the state. And I appreciate the invitation. So I enjoy the rest of the conversation. I look forward to the rest of the conversation, I should say. Thank you.
Excellent. Thank you very much, Scott. Did I miss anyone online? Thank you. I know we had a few people join us. Would you like to introduce yourself?
Good morning, everyone. My name is Walt Jones. I'm from Northern Arizona. We serve people with developmental disability, and we're a recipient to 5310. So I always came here to learn more about the technology and what the opera is and networking resources. So we finally got into disability, went around and around. So thank you for attending and being invited to this summit. Thank you.
Thank you. They say that showing up is half the battle, and you made it. And your colleague, would you like to introduce yourself as well? If you can please press the button on the microphone when the light is green, that means that it's on. There you go.
Good morning. Good morning, everyone. My name is Delphine James, and I do work for Chinle Valley School too. And we do serve 30 individuals with developmental disabilities up on the Navajo Nation in Northern Arizona. So, good morning, everyone.
Excellent. Good morning, and thank you for coming. Last call. Did I miss anyone else in the room or online? Okay, excellent. We were very intentional in our outreach, so we're thrilled to have all of you here. We very specifically reached out to folks from healthcare, transportation, and technology, because those are the three areas that really need to come together and are coming together in many examples. And we're looking at ways that we can leverage what's already working really well and then be able to do something new together that, as Sam said, that where we're more than the sum of our parts. So at this point, I'd like to turn it back over to Todd to lead us into the next item on the agenda. Thank you.
Sure. Thanks, Amy. The next item on the agenda is to look at the agenda. And so Hezekiah, if you wouldn't mind this next slide here. I do think that those introductions are probably one of the most important things we'll do today to get kind of a feel for who's all in the room and who we're working with. again, special thank you for everybody coming. I think that it was very rewarding on my part to see how much interest there was in this topic, and we're definitely kind of on the right track in terms of trying to look at how to solve these transportation issues. And I think Mr. Andrew Renda's comment around access to care, or thinking about transportation as more of how we can thinking about transportation in the context of just access to healthcare, I think is going to be reflected in what we heard in the first summit, which is what I'll introduce here in a second, and what we're hoping to accomplish here. Because I think the fundamental challenge is that, from a transportation perspective, we have a couple of those transportation providers in the room today, and there just simply isn't the capacity, there isn't the resources to be able to respond to the growing need. And so I do think the work we're doing here today is going to be really, really important. So with that, I do want to kind of just lay out this agenda. This is definitely a flexible agenda. I don't think that there's anything really set in stone other than lunch. Is that I think that we will have lunch brought in. What I do want to do the next agenda item, and we can kind of probably disregard the times, but I do want to provide some background on what we heard from that first session. I think that can be very abbreviated, because I think that if I'm getting the sense in the room, I think we know a lot of the directions that these conversations have led to in the past. And then the lightning round initiative is where we've already heard from some of our partners here today, but we do want to allow them a little bit of an extended period to kind of give a rundown of some of the exciting initiatives that they are working on. And so we do want to spend an hour roughly with a handful of agencies that we've discussed, we worked with previously, to kind of help frame, some of the ongoing initiatives. Because I do think one of the themes that we are recognizing is there's an awful lot going on in Arizona. And so how can we kind of work in coordination and sort of champion some of the initiatives that are already taking place. So with that, and then you'll see here, we'll have, after that lightning round initiative, we are going to start kind of setting the stage for the afternoon and some of these workshops that we're doing. And then you can see after lunch, we are we're going to be kind of actually spreading out throughout this. Is it all going to be on this floor? We'll give it more of an overview on that in a minute, but hoping to form little teams and kind of have breakout rooms and dive real deep into some of the potential solutions that we're going to come up with, or that we've feel like we have a head start on, or if there's any new ones that we want to investigate with this group. So with that, is there any questions on the agenda? I do think that we will, without a doubt, end at 3, no later than 3, given rush hour and those of us that need to travel out of town. So
thank you. From the individual that signed in as F. Jantone, I'm sorry, but I'm having issues with my audio. I work for the Tohono O'odham Nursing Care Authority from the Tohono O'odham Nation. I manage the transportation department here at the nursing home and assisted living. My first time joining, so here to learn from others. Thank you very much for joining us, and we're thrilled to have you with us.
Great. So jumping into the highlights of day 1 and the vision for days 2 and 3. Hezekiah, I think we may have to jump ahead a couple of slides, maybe even one more. There's maybe even one more. So again, access to healthcare, thinking about a wide range of how we could do things better than how it's currently taking place. I think that, some of the inspiration for this summit stemmed from working with transportation providers and having them travel 2-3 hours for a long distance healthcare appointment, just for have that healthcare appointment to ultimately be canceled. So that was one of the areas that we definitely recognized, geez, we do not have the bandwidth to have any of these inefficiencies. And so how can we look at doing things smarter? And so, as some examples that we kind of brought into this summit already in terms of things that we thought we might see some opportunities around. Telemedicine in rural areas. I think I've learned more about telemedicine than I ever thought I would in the past month. And I think it's really exciting. I think that can potentially have a really profound impact on rural Arizona. Looking at mobile clinics, we don't always have to be bringing the patient to the healthcare, but potentially looking at bringing healthcare to the patient or some of these rural areas. Looking at coordinated appointment scheduling and working in close coordination with transportation providers. I think that's if there's a kind of a fundamental goal that we are hoping to have through this summit, is to get our transportation and healthcare providers kind of working hand in hand, recognizing the challenges that each other are facing as we look to solve some of these solutions. Other partnerships and sponsorship ideas. I do think that there's a lot of interest in healthcare access. And so how can we kind of help connect those puzzle pieces around some potential solutions. And then, other ideas. I do think that this is kind of our starting point, but we also recognize that there's probably a lot of other areas that we could look into. And so we're hoping to kind of set the stage for that again this afternoon. So the next slide, Hezekias. I will real quickly run through this. This is a kind of a snapshot of our webinar we had on March 28th. Again, you can see here some of the prompts that we were looking at gaining from the group. It is very interesting. I think that the webinar on the 28th was largely attended by transportation providers. And I can see here today, we're largely represented from the healthcare side of things. So it's really an exciting kind of combination of the two. If you want to pop to the next slide, things that we heard just as a summary. Again, this was probably, we spent an afternoon sort of in a pretty open conversation around a wide variety of topics. I think what we heard is there's an awful lot going on in Arizona and very little coordination. And so definitely an opportunity there. We found that some transportation providers were simply taking it upon themselves to help address these areas. We had transportation providers that are looking at purchasing an RV to outfit it as a mobile clinic to bring healthcare to rural areas. So I definitely think that a lot of the transportation providers are really kind of stepping up and taking a major role, because this is, again, as I mentioned, it's a pretty dire and challenging spot they're in trying to address the need. Community partners. I think one of the most impactful comments that we had from that first session was as a part of a survey we took, is a community partner saying, hey, I would really want to get involved. I just don't know how. And so hoping we're kind of providing that platform for that. We do think that there's a lot, we're hearing that there's a lot of potential changes coming across the board. I think we're seeing, continued centralization of healthcare providers. And so we're going to see that these problems aren't necessarily going to get better on their own. Communication pieces. I think that's a fundamental piece from a transportation side of things. A lot of the providers didn't necessarily know how to communicate with the healthcare providers to express their needs, to kind of present the challenges they're being faced with. And again, I think I'll beat this over the head, is that transportation providers can't afford inefficiencies. I think there's just simply not capacity. I was going to include a slide in here talking about the funding discrepancy in the state, but I didn't want to be a downer, so we'll keep that keep that off for now. But so that's kind of a snapshot of what we heard. Again, kind of in a variety of different directions the conversations took. But on the next slide here, I think that we sort of started to frame some themes that we identified, is that there does seem to be a lot of big picture items. I think items that are that it seems like it's going to be a never ending trying to widen the group that we're looking to include. And there needs to be some sort of advanced collaboration at the highest levels of healthcare. I don't think that's anything new or specific to transportation, but I do think that's a fundamental theme that we found. I think that there's some exciting things happening around referrals that I think that we went into that summit on the 28th not knowing about, but now that we kind of have seen some work that's already going, I think there's some great opportunities there around patient referrals as well as communication. And I think there's always a need for those meaningful partnerships with healthcare and transportation. So that's kind of some, big picture kind of topics that we identified, but then we also saw, hey, there's a lot of opportunity to get started right away. And so that's where I think we're hoping to really dive into today, making the right connections with you all. I think that there does again seem to be some opportunities from a funding perspective, that we think that there's a real opportunity to grow legs on some of these pilots that we're hoping to initiate. And as well as kind of identify some both community champions, as well as I guess you could call it from various sector leadership, and bring them together to help form some of these pilots. So with that, I think the next slide is my last slide on the summary. And you can just probably, I think there's a bunch of there we go. So this is emphasis on draft. But this is kind of how we wanted to frame today's conversation, is that we do think that there could be opportunities to explore a healthcare and transportation statewide task force. Recognize this is a very big lift, but we definitely recognize that there's a need. And so you can kind of see some of the things that we immediately heard in terms of how we could look at supporting that. Additionally, telemedicine. I think telemedicine, as we think we've heard earlier today, we definitely heard it extensively in our webinar on the 28th. That seems to be a tremendous opportunity for some partnerships. So how can we piggyback on what's already happening, also expand that, bring in new partners. How can we do anything we can to kind of make that telemedicine more accessible, more widespread across the state? And is there a role for our transportation providers to play in that? I think that you heard from some of the providers earlier today that they're already doing quite a bit. And so I think there could be a really cool partnership opportunity there. Healthcare and Transportation Communications Platform. Again, that's some work that we've been working on in coordination with the ASU KIC program regarding transportation and healthcare communication pieces. That whole topic about a transportation provider traveling 2-3 hours for an appointment that wasn't scheduled. How can we try to eliminate the best possible by kind of using technology to streamline those communication pieces? And I think the additional general supports for training and outreach, I think that could potentially be captured in the healthcare access, or that could form, kind of take its own direction. So with that, I guess just want to reemphasize again that this is kind of the draft. This is where we see a starting point for some of the conversations today. But I'm kind of just curious hearing from the group if there's any comments, or if there's other areas of interest, or if there's, are we on track with this? I'm just kind of curious hearing from the group.
One suggestion I have, so I work a lot nationally, and I work a lot with a lot of rural states, Oklahoma, Southern Georgia, Appalachia, Ohio. And it might also be helpful to look at what others are doing in the country from an innovation standpoint, to be able to like put a stake in the sand and say, I hadn't really thought about that. Because I see some really going on in rural parts of the country that includes transportation as well as technology, as well as telemedicine.
Absolutely. And I will just say, I do think that's why we were really excited with the partnership with CTAA and the National Center for Applied Transit Technology. Is they also do work in rural pockets throughout the nation. So that's great. Yeah.
I would also like to echo that and add that, absolutely part of the solution is having connected communities and putting the tele into telemedicine and telehealth. And so here in Arizona, there's been great investments as well as federally in that type of infrastructure. And that's absolutely part of the solution, from laying fiber as we do road work. If you've traveled on I-40 or I-17 lately, you've been past the crews that are running fiber now along the road. We're so much more efficient about it. But we do need to absolutely connect people, whether that's in their home or their closest access point, or public spaces where they have access to technology if they don't live a connected life. And that is a key to our future. And I can't think of a better way to spend all of that digital equity money, and money that would allow us to be able to say, you can go to any library and take your blood pressure. You can go have a pre or post-surgery follow-up clinic down the street from your home, whether or not you have a cell phone in your pocket. And so the connectivity piece, the broadband, and that's my other hat today, representing the broadband community, because it's been very nice that our state has invested money. We do have experts here. There's the Arizona State Broadband Stakeholder Network, Mauricio and I both participate in. And along with our state librarians and our community health centers, we're getting people connected in their home. We're getting people connected to the Affordable Connectivity Program. And that's part of the solution too. From grassroots, getting people connected in their home. And if that doesn't work, getting them connected in the library or a place where they can have access to technology, because that's access to healthcare.
Thank you. So we're on track. Okay, great. Okay. Well, I do think now we can move into the sort of lightning round Arizona initiatives presentations. I think we've spoken with 5 or so of you before, and we're again, I think we got a lot of information out of the introductions. But I think this is an opportunity to dive a little bit more, and again, hopefully inform our conversations for this afternoon. And so I guess I do think, Mauricio, if you wouldn't mind kind of kicking things off, and 5 to 10 minutes, and we have 5 agencies, and we're hoping to just hear a little bit more that we didn't hear in the introduction.
Well, thank you for the opportunity. As I mentioned earlier, I feel very honored I'm very fortunate to be able to work with a lot of the CBOs, nonprofit organizations, community-based organizations as part of our advocacy department at Care First. Many of you in this room, we have partnered, and if you haven't, I'm looking forward to having that opportunity to partner. And sometimes when we talk about partnerships, it's not, a lot of it goes to funding, but it's just sharing resources, it's leveraging resources, maybe providing technical assistance. It could be making an introduction to someone that can provide those gaps being filled. Some of the initiatives that we have been involved with for the past couple of years, I'm glad Vince is here because he can talk more about it. When the Whole Person Care Initiative was launched by Access back in 2018, that community cares platform was one of the main focuses as far as linking the whole state to community resources, and not only providing resources, but the great thing about this tool is that you are able to close the loop, because many of us have done many referrals in the past. We give a piece of paper, we give them a resource list, but we never really find out what happened with that referral. You know, we just hope that that person was able to access those services, but we never hear back. The big advantage of this community cares platform is that you are supposed to get notification and collect data on those referrals that are going out for all of the SDOH needs that are out in the community in the whole state of Arizona, and actually get a response whether that person was able to access those services, and if they didn't, what was the reason? Was it because of transportation? Many other reasons why many of our community members cannot get to certain resources. So we've been working with Contexture, with Unitas for the past couple of years and making sure that this initiative is successful, because there's a lot of investment by the Medicaid administrator here in Arizona. Another initiative that we're closely working together, obviously Janet's here working with telehealth, telemedicine, and the library system. The broadband that became to the forefront with the pandemic. And at that time, it was really just focused on kids getting education, right? Because all of the children, all of the schools were shut down. They had to go to a virtual environment. And to be honest with you, I don't think the schools were prepared. As we found out, a lot of lessons learned there. But then 2 years, 3 years after that, that's not going away. The virtual environment is here to stay. Telemedicine and telehealth is here to stay. And we have to use that as a tool to make a lot of the things that we have talked about, whether it's transportation, it ties to employment. Even when we had to go get vaccinations for those, we had to make appointments online to, be able to just get a vaccine. And a lot of people did not have access to the internet. Many of them just had a phone and didn't know how to navigate the system. When you're applying for any type of government assistance program, it doesn't matter whether it's access, whether you're applying for SNAP benefits, any type of government assistance, or when you fill out a job application, if you don't have broadband or you don't have access to a computer, it becomes a huge challenge. Some other people mentioned social isolation, especially with the senior population. There is a virtual environment where people can become part of groups, socialize with other people that might have some resources for them, or just be able to speak with them, giving them an opportunity to socialize with other people, individuals that maybe that happen to have a disability that is really difficult for them to get around. I know that's one of the challenges when it comes to transportation, where the coordination just needs to get a little bit better, because sometimes you'll send a driver and they forgot to mention that they have a wheelchair, or that maybe it's a family and they need car seats. So there's got to be better coordination and tracking of all of the challenges that are out there. So maybe if there's like a big database where all this information is being collected and tracked, when someone makes an appointment, that person has a challenge with maybe a wheelchair, a walker, maybe they're recovering from a surgery and they have a brace on their leg, or, those details that maybe the members that are making those appointments are not really thinking of when they're trying to schedule a transportation appointment. It could be the size of the vehicle that's needed. Sometimes we hear that, the members being picked up late, or if they make it to an appointment, they're waiting outside, waiting for that return ride back to their home or where they came from. So I believe those challenges are opportunities. And I think that's the reason why we're having this summit. And I look forward to hearing about other organizations or companies that are focused on those needs in Arizona. As I mentioned earlier, we've been up in Northern Arizona since 2018, and we echo all of the challenges that are around the room, the distances, sometimes the area, especially up in the Navajo Nation, where there's the infrastructure as far as roads go. It's very difficult sometimes to give directions to someone because the streets, there's no street signs. It's basically telling someone, hey, if you see this red house and a large tree, that's where you make a right. So there's a lot of challenges that we take under account and respect, that we have to take under account depending on the area that we're trying to serve. The last thing that I'll say is that Care First, as a health plan up in Northern Arizona, serving the 5 counties, we have 86,000 members in Northern Arizona on the access side. And then we also started serving the SMI population, which is seriously mental ill population, in 2020. And we have 6,000 of members that we serve up in Northern Arizona. So obviously, when you qualify for Medicaid access, those members come with additional challenges, and that's where we're looking for resources, connecting with faith-based organizations, government agencies, libraries, schools. That's where we find those resources that our members need so they can focus on their health. If anyone has any questions, I'll be more than happy to answer any of those. Thank you.
Thank you, Mauricio. And so just wanted to, I know that we have a lot of participation here from Northern Arizona, which warms my heart because I think that's who I was reaching out to a lot of the times. But we're definitely trying to tackle a statewide approach. And so I do think that the challenges up in Northern Arizona are also challenges that are similar in Southern and Western and Eastern Central Arizona. So just kind of a tidbit there. Vince, could we kind of turn to you next and with an extended overview of Unite Us?
Yeah, no, I think it's a good kind of segue. Thank you, Mauricio. I think just to kind of co-sign everything he said and build off that. I mean, it's very evident with all of us being here and with other domains of representation, Arizona's system is a little bit fractured and splintered. So everything seems kind of siloed. And the theme I continue to understand is that there's some connectivity issues, communication issues. How do we share information? And so that interoperability component is something that Unite Us is looking to focus on. Again, as I mentioned earlier, we are embedded in 44 states, a lot of them a little bit more mature than what Arizona's in. We're in more of our launch phase of this web-based platform. And what it does is really pull the ownership out of the family or individual and takes that away, that it mitigates that stress on them so that the platform actually does that for not just the individual or the family, but for the provider. Not all providers understand where to refer. And as you mentioned, the way the system is now is that we just shoot out referrals left and right. And then there is really where's the closed loop piece of that? What was the outcome of that referral? Unless you have like a really intense relationship with that provider or service member. So the platform is kind of an automation of what happened with that referral. So what we're doing right now is really focused on identifying where are the adequacy issues, and we can't just and we are onboarding a lot of community-based organizations and non-community-based organizations, which the non-community-based organizations we would refer to as conveners. So Maricopa County Department of Health, Maricopa Association of Governments, who are your constituents? Who are your members that might want to be able to be a part of this this platform? So that is the phase we are in right now. We're in the build phase for Arizona. So my team and I are really embedded. We have community engagement managers in Southern Arizona, Western, Eastern, Northern. And what we're doing is doing info sessions for community-based organizations to just learn the platform, to understand it, to ask questions. It is kind of something that is so funny because everyone asks every time, like, who's paying for this? And it's Access. Access is fully paying for it. So not long-term, but they're paying for everyone to onboard and get the training. So those are the kind of things that are popping up. And what my team and I are doing is just staggering that approach to bringing it in, because you don't want to bring in organizations and then you really don't have a referral network. You know what I mean? So the adequacy has to be there, and we're being very meaningful in how we onboard various providers that are embedded in those social determinants of health sectors. The other thing I would say, just to reiterate, is that it is a closed loop referral system. So you will know what happens with the referrals that you are dishing out. And I think oftentimes that will help you with your funding. It'll help you with policy making. If you know what are the outcomes and not just ticker count of referrals, that's really not the important piece. It's what happens with those referrals and the utilization. So that's something that we're tracking, and all of the organizations have access to those insights. Again, interoperability is a key thing. We have a lot of different portals, platforms, health information exchange. Unite Us really pulls them all together. And so there is a lot, it mitigates a little bit of that. How do we all speak to each other? Because a lot of times that's kind of the hard part. And then I will just emphasize the Community Cares program, excuse me. That is the program that is funded through Access completely. We are working in partnership with Contexture, who is our state Medicaid health information exchange system. So right now we are really working on just onboarding a lot of the eligible, which is pretty much everyone, eligible organizations to the platform. Again, it's not a lot of equipment or hardware, it's just training. It's a web-based platform. So it's a practice transformation approach to how do we get them to understand, how do they utilize, and it actually brings up who's available. If you're a healthcare organization and then you want to do something around education, maybe they don't have that information, but the platform will pull it up for you and it'll give you a geographic understanding of how can you refer for what needs. So it's very targeted, very specific. But again, that comes with some learning curve for a practice or any provider that's in the state. I will say this is still kind of a 30,000 foot view of the organization, but we are working really hard with Access, DES, Department of Economic Security, and Arizona Department of Health Services, and Department of ADE, Department of Education. So we're focused. We're doing a lot of departmental meetings this month with the department heads. So I just put that out there as that this is something that I think is going to be very helpful in doing that connectivity as we move forward.
Excellent. Thank you very much, Vince.
Thank you.
We're very excited to be able to work with you.
Thank you.
So we appreciate you being here. Next, I'm not sure, Andrew, Mary Jane, would one of you be able and willing to provide an update, or kind of maybe go into a little bit more detail about Humana and how you might see yourself being a partner in this space? Do you want us to wait until Chris gets here? If she is imminently arriving, we can go to another partner first.
I
Or
could talk a little bit about population health and
okay, perfect. That'd be
determinants, and
great.
she
Thank
can
you.
fill in the Arizona specific stuff.
Excellent. Thank you.
Yeah. So earlier I mentioned, we think of population health as a holistic model of physical, mental, and social health. And, as we dive deeper into social determinants of health, we have to think about, as a health plan, what's in our arsenal of ways that we can address these care gaps. And so for us, that can be value-added benefits. It can be services that we offer. In many cases, we're trying to incorporate social determinants into our model of care. So as we think about staffing with nurses and things like that, we have social workers. Now we have community engagement folks and community health workers. And so thinking about all the different kind of ways that we can do that. Innovation is another space, so as we look to pilot with new organizations that are, really leading the way, whether it's in food delivery to address food insecurity, or it's housing investments. We're doing a lot with emergency housing. We've invested in actually building bricks and mortar housing developments based on tax incentives and things that are on there. And what's important about that is that it's not just investing in the housing itself, but it's the infrastructure surrounding it. So can you put a health clinic on site? Is there public transportation that is aligned to the development? All those types of things, a grocery store that's close by or embedded in development, I think is really key. So we look at a lot of different ways to do social determinants based on, the things that we can. And a few people have also mentioned, analytics and data. So I'm happy that technology is a component of what we're talking about today, because, and actually Mary Jane and I were just talking in the Uber on the way over. Humana has over 100 predictive models. We can predict all kinds of events, whether it's you're going to develop diabetes or you're going to end up in the hospital. But a lot of those sit on the shelf because they're not particularly useful. Okay, that's going to happen, but where we really need to go with AI technologies and that kind of thing is predicting the next best action, or what's the thing that's going to be most useful to that patient. And so, as we incorporate technology in this idea of addressing transportation, again, like I said at the beginning, it's an access issue. So does that person need transportation to get to a clinic to see their primary care doc? Does that person really need someone who looks and talks like them to visit them in their home and talk to them like a human being? I think getting to the point where we can predict what they need, what's going to resonate with them, what they'll engage with, I think is really key to helping us help those people and close those social determinant gaps. So.
Sorry, I usually have a big enough voice that people say, oh, we can hear her anyway. One of the things Mauricio said earlier about, healthcare is in the community. And when you think about a rural state like Arizona, and I happen to have lived in Georgia and I covered rural Georgia for my company previously. We would have a pregnant mom in South Georgia with a high risk pregnancy. A drive to a perinatal center for a very high risk neonate could be 4 to 5 hours. So if you literally, so companies like Humana get innovative. I will just tell you, because I do not take no for an answer for that mom, because that's just who we are. We're doing a partnership with a national maternal fetal medicine company that will do virtual visits with that mom in her caregiver's office in South Georgia, whether it's a family medicine physician because there might not be any OB in the county. So I think what happens is when you have a company that comes in and we're at risk, when the state of Arizona hires us someday, and I used to work for a state, we're going to hold those companies accountable. And we're going to say, what are you going to do? And how are you going to partner with our community-based organizations? So what I did when I was in Georgia, I went to the biggest provider in the city of Atlanta. They were like, oh, Mary Jane, seriously, going to South Georgia with a perinatologist? Like, are you serious? And I said, okay, let's get innovative. Well, they had some innovative providers. And they said, we do have a solution, Mary Jane. And that's what I wanted to hear. And so that's what you get somebody like me that's worked in healthcare 40 years. I worked on the provider side. We do partnerships with providers. We also do partnerships with community-based organizations. Transportation, I want to get your name, because really we need people, and we also know that oftentimes when we need you bad in a rural area, we're going to get really creative about what type of transportation, and we're going to work within the confines, the regulatory requirements in Arizona. 2 former Medicaid directors, I had dinner with them last night, Tom Betlock and Jamie Snyder, and I are friends. We want to do things the way Arizona fits for Arizona, because we also know it's not a one size fits all thing. It just isn't. What they need in South Georgia is going to be different than what we need in Arizona. We also know that the aging population in Arizona is about to skyrocket. So when you talk about like access to care and it's only going to get worse, it's only going to get worse in 2 states, Arizona, well, 3. Arizona, my state that I live in today, Florida, we are like blowing up with growth in seniors, and Texas. So again, going back to what Andrew said, we hire local people as a company. I mentioned our 9 CenterWell clinics. Our 9 CenterWell clinics, I challenge them every day. I want a CenterWell clinic in some of the remote places. And if we can't make it viable financially, let's do something remote with a local provider to support them in growing their business. So that, I mean, those are the types of creativity and thinking out of the box that we do to get somebody access to care in the best way possible for them and their community. Because a 4-hour trip for a pregnant mom that's 9 months pregnant probably isn't going to work.
Excellent. Thank you very much.
Great. And I understand that there'll be a Chris joining in and can, great. Okay. That's no problem. I do think that I'd like to turn it to Kent Ellsworth, who will be with us, joining us virtually with Verde Valley Caregivers out of Sedona. And I think you heard a little bit from him earlier, but I think that when I picture innovation from a transportation provider, I think Kent's done a lot of really, really great things, and I want to allow him an opportunity to share with the group. So Kent.
Thank you, Todd. And first, I wanted to go a little bit deeper into a description of the population we're serving. It's not really a broad base of individuals 65 and older. It's a discrete cohort. And basically, we serve about 1,900 people a year. The majority live alone. None of them are able to drive. They're low income. 70% have no access to internet. They all have serious health conditions. And at least 20% or more are experiencing cognitive decline or even outright dementia. So what happens in the current environment with healthcare and patients who are really, high needs, high risk patients? For example, the healthcare systems we have here have a consolidated scheduling system where we don't even get to contact the provider that has the appointment for this patient. We have to go through this a group of people on the phones in Flagstaff. And when the healthcare provider has to delay or cancel that appointment, they contact the scheduling system that then tries to send a text to one of our riders who doesn't even have a smartphone. And so there you go. I mean, it's just a lot of disconnect for this cohort of individuals that really need the most support of all. And so that's where technology really needs to grow to help bridge this gap between transportation providers and organizations providing other services, and then the healthcare providers themselves. So we need a really rapid communication that is very simple and that is very effective. We need to know right away, not have to go through a scheduling group to be able to know about that appointment that has just been canceled or delayed. So that's one very important thing. Getting together, working together, communicating regularly every day. Right now, we have 20% of all the appointments we have are canceled. And so that creates a lot of difficulties with deploying all of our assets. And I think the other part of it, though, is the good part of it is how well we're getting collaboration with Northern Arizona Healthcare regarding virtual care assistance. And we have so many wonderful retired nurse volunteers and physicians. They're all helping a lot. We've had 2 training sessions. They're ready to go. And we set up a referral system with Northern Arizona Healthcare. And I think it's not really a delay, but they're in the middle now of convincing all the providers that, okay, this kind of an appointment is appropriate for virtual care, but some of these appointments are not clinically appropriate for virtual care. So being able to decide which ones are which, and we'll get those volunteers deployed out to the home. And we're set up with a first responder type of internet access on all these tablets. And so we can do about 8 virtual care appointments a day in assistance. And we'll be transitioning that team into remote patient monitoring assistance because of the fact that so many of the specialty providers are out of this area. We'll be getting into remote patient monitoring, which is a lot more technology that our folks wouldn't be able to figure out if we just mailed them a box with all this stuff, plug this in and put this around your wrist and all of that. They're not going to be able to do it, but we'll send out our team of retired nurses to assist them with that. And the other part too is we know so much about, the spectrum of SDOH services. So about a little over a year ago, we started social outings. So we use our vehicles, our volunteers and our staff vehicles and our wheelchair accessible vans to get people to outings at least once a month. And we have volunteers calling people on the phone, nice friendly phone calls, and in-home visits as well. And we see the virtual care assistance as a really great opportunity. We'll arrive at the home a half an hour early, make sure we get set up. We configure that even a 15-minute appointment will probably take us an hour or so, but it's a great social opportunity with our volunteers and the people we're serving. So we're looking forward to that. We do a lot of pet care because sometimes that little pet is the only friend this person has. So if they need assistance with veterinarian bills, we pay 50% of that. We purchase a lot of dog food and make sure that they can maintain their pets safely. And we assist with in-home chores too, fixing leaky sinks and steps and all of those kinds of things so that we can make sure a person doesn't have too many of those problem areas in their life in the spectrum of social determinants of health that may come back and make it difficult for them to stay in their place of choice. And of course, lots of trips for shopping, about 30,000 trips altogether. And so it's that all those wraparound services. The most important thing here, number one, is a total, unwavering, solid connection to healthcare providers. They need to talk to us. We need to talk to them. And so that's what we want. And I think that will work, whether it's transportation or virtual care assistance or any of that. We just need that solid connection. They need to see us as partners in patient care. And I hope that's what we can find. And I appreciate everybody's work and looking at the technology. I think it will take some skillful technology for us to maintain that rapid connection to the healthcare providers serving the 1,900 people we are charged to serve right now. So thank you very much. I appreciate what everybody is doing. And it looks like we're making progress. Thanks.
Thank you, Kent. Continuing along the lightning round, Janet, could I turn to you and you can be Janet or Aaron or Mala or?
I think I'll be Janet first.
Okay.
I'm more comfortable with that. Well, I'm so fortunate because I have the best job on our team. I put the tele into telemedicine, telehealth. Oh, here we go. Thank you. I think that I should begin with some resources. So when I run out of time and you make me stop talking, I've shared the most important thing. And I really do think that obviously real-time communication is part of the solution here. There are also some great resources that I want to share. The first one is TAPS map, in which telehealth access points are being mapped out state by state. So if someone wants to get connected to an existing provider, if they want to go someplace where they know they can connect to someone who delivers telehealth services, and complemented with that is a telehealth service provider directory. So getting people connected to care if they travel out of state, if they are in state, and if they want to not drive 3 hours for a pre or post-surgery clinic. There are so many things we can do for people. We can offer people breast cancer support groups in their own language, but how do we get people connected to that? So we've been working hard to develop resources, not only for Arizona, but the 5 Western states. And if you go to that TAPS map, you can get connected to telehealth. The other map, and if you haven't been there, you've got to go. It's the Arizona Commerce Authority webpage. Their homepage has a Arizona assets map. So you can choose by layers where all the hospitals are, where all the schools are, where all the libraries are. And then you click on that entry and it gives you the address and the phone number of that library. You click on the entry for any other of the resources, and it's just that minimal information. Same thing with the TAPS map. But if you're looking for the resource, you've got the name, you've got the number, you've got the geographic location, and that's a big part of it. And in the end, it's all about communication. So if people can identify where they need to go. And then I think a couple of very important points, especially from the gentleman from Verde Valley, is, it's not everything everywhere all the time telehealth. If we can prevent half of someone's appointments, we're really doing them a great service. And it might not always be appropriate to not travel. You may need to travel. But one of the most exciting projects I've been able to work on recently is the telehealth in libraries. So this is something that we demonstrated up in Tuba City, connecting a chapter house to Tuba City Regional Healthcare Center, so that as the public health nurses work with the community health reps at the chapter doing screening for diabetes, the physician in Tuba City was in the walk-in clinic sitting at the computer looking at that patient's electronic medical record and could say, oh, gee, you don't need to come here for your medication refill next week. The public health nurse is going to be back out there next week. And it's all about efficiency, right? To be that efficient with how you can deliver services to people, I think is what we get with the telecom connectivity. And it's the data sharing during that conversation too. You need to have that information, right? But I think it's just a great example, and it also extrapolates to what we're doing in the libraries. We have done Mala, I have to mention by name, Mala Muralidharan, who's been a friend and colleague for 20 years in telecom here in Arizona, almost single-handedly has connected 9 different chapters up in Navajo area with E-rate funding. So she has maximized our state's E-rate funding so that, there are places now with routers in Southern Arizona with the folks that Mauricio and I have been networking with. They have figured out where to put the routers in Southern Arizona to maximize and reach students, and where to park the bus with the router on, that much primitive type work to get people connected. Well, now more and more people are connected. And in Southern Arizona, we have 2 library pilot sites. And we're working at solving a lot of the issues with this. First of all, we're giving our College of Nursing students hands-on human interaction with people as we roll out these sites and we show people how to take their own vitals. That's really nice. We've made part of this kit medical grade tents, so we can do screening and provide services, get people connected to their own provider or their own resources in their own community at the Arivaca Library and the Ajo Library. Through broadband funding grants, the Arizona Commerce Authority, the next sites will be the Tohono O'odham in the south, and then up in north, there will be Tuba City in the library. We'll have our next package, which includes a digital scale, blood pressure cuff, pulse oximeter, and a digital stethoscope. If you want to prevent a pre or post-surgery follow-up clinic, someone needs to listen to your heart sounds. And we hammered on this a lot, and the libraries have put together great protocols for being able to manage these devices, because it's not about building clinics and libraries. Librarians manage the devices. They check them out just like they check out books. You can check out a crock pot at some of the libraries. You can check out a telescope in South Tucson. The libraries are amazing. They're all different. They all have different resources, and they all have different protocols in terms of how they manage their stuff. But for telehealth, they have to scrub it every night and get rid of the data. And at the Arizona Health Sciences Center, we often will provide iPads for people to participate in a ostomy support group or something, but they can't connect to anything where you don't want people to go, and you still have to scrub it clean when you get it back. So, you know, the practicality of managing devices, the librarians are resource managers. There's still the training piece. So we're very unique here in Arizona. For folks who aren't from Arizona, I want to give a little bit of detail, because the entry-level type healthcare workers, the boots on the ground, boots in the mud people, are those community health representatives and community health outreach workers and promotoras. We've got 3 different flavors of those people here in Arizona, and they all have different roles and they all have different backgrounds. And the great news, if you think about diabetes as an example, doing diabetes screening, providing diabetes services to people in their hometown as much as we can. You're not going to find a podiatrist in many of these locations, so you're going to travel for that. But a great opportunity for private public sponsorship and increasing the services that we provide to communities is by developing that broadband. You need the bandwidth to do things like tele-ophthalmology screening, take a couple of views per eye, screen in people's communities, and then have them travel for follow-up. You've just cut their trips in half. And diabetic patients, you want to screen them every year. So how can you, if you live in a rural place and you're diabetic, you should be seeing a podiatrist, a nutrition specialist, your primary care provider, a pharmacist, and an ophthalmologist. You're not going to find those people we're the 6th largest state. So maximizing the connectivity to keep as much as we can in people's communities, and definitely telehealth and libraries is going to help us do that. And by continuing to develop that model in both Northern Arizona and Southern Arizona sites where we know we now have laid groundwork and we've got some bandwidth, we can also now deliver those services. And then the other thing I want to say is, of course, it's all about efficiency, and it's not just about telehealth. The bandwidth is also about connecting people to being able to build and manage their own business, to get interviews for jobs, to create an email address, to be able to have the phone booth of the future, you know, to have that private space in a public place in the library. It's great for healthcare. It's also great if you want to schedule a job interview. So there's a lot of things we can do by investing and maximizing all this crazy money right now that's out there for bandwidth and technology. And I think that one of the greatest investments we can make is for doing that for people who do live in rural Arizona. And that's been our growth spurt. And then I also, not to have a disclaimer, but it's also about urban. I have to say that it's also about urban. I can drive 2 hours across town here, right? So I think that it's about efficiency more than anything. And with regards to where we are now as a society, it's also about access to healthcare. Plenty of propaganda. Please stop by my table.
Jen, I had two quick follow-up questions. TAPS program, would you mind, what's that acronym again?
Telehealth access points. And I'll grab that URL and share that by the end of the day. Of course, I don't know it off the top. Oh, I can find it pretty quick. And then Arizona Commerce Authority is the Arizona Assets Map. And it's really a great resource for anybody who's looking for that type of data about Arizona. You can easily find a lot of great stuff. Mines, I loved looking at that link. And when I served on the broadband task force, and now we have a new broadband director who's a great guy. And I'm sure the broadband mapping group will start meeting again, because the idea would be to do an overlay map of broadband in Arizona. Part of the issue with regards to the federal funding from the FCC and other entities is the fact that the maps that have been produced by the FCC are very arguably inaccurate. So if we really want to improve broadband in Arizona, we've taken a different approach, and we're figuring out if we can map where it is, then we know where it is not. If we map where it is not, then we know where it is, which, you know, that's got to be part of the future, is also funding that connectivity. And then also as an advocate for the College of Medicine, University of Arizona, both in Tucson and Phoenix, is part of the solution also is recruiting healthcare providers who want to live in these rural towns. That absolutely has to be part of the solution. People who are from that town, who look like the people of that town, who are going to be their healthcare providers. So there's a lot of solutions, and definitely telecom and telecommunications connectivity and training are all part of it.
Excellent. Thank you. And just a quick note, if you have links, materials, websites that you'd like to share with the participants of this event, please do feel free to email those to me or Todd, and then we can follow up and send those out to you afterwards. Thank
you. If I can just piggyback a little bit on what Janet
so your mic, please. Thank you.
Sorry, if I can just piggyback on what Janet mentioned. And I think we are all aware of this challenge or opportunity, is that we got to meet people where they're at when it comes to education, because you can have technology. You can have a nice tablet, phone, whatever it is that you're using, but there's a lot of people out there that have never really turned on a device before. It may be hard for people to understand that, but it's true. So the good thing with the libraries is that they have digital navigators that can help you with those kind of questions, no matter how basic assistance of someone needs in different languages. We got to just meet people where they're at and kind of just introduce them into technology, because there's different levels of technology. And the education part, building that trust, is also very important as well.
So on behalf of Erin Larandas, I would like to say that she is our digital navigator for the state libraries, and we're working closely to develop digital health navigator materials so that we know if someone wants to apply for affordability connectivity program or SNAP benefits or something, you can actually schedule an appointment with a librarian, a digital navigator, who will help you scan those documents and make that application. So they're an incredible resource. They are at connect-arizona.com. And digital navigators, they have multilingual capabilities, and they can help you troubleshoot your own technology or get you connected to technology if that's what you need as well. So that's a great URL and a wonderful service from our Arizona State Libraries.
You know, I just wanted to say thank you to Mauricio for adding those additional comments, because I think one of the things that's really important in healthcare is that level of literacy that the members might have, because it's very different for each person. So I know, and you also mentioned the promotoras and the community health workers, and I think Humana also mentioned them as well. These are things that Equality Health is currently doing. We are working with our providers with their most complex care patients. So for those of you who are health plans, it benefits you because your patients are not costing you as much money. But really what it's doing is providing that unique care that each individual person has, because we're providing the training to the providers on speaking in a 5th or 6th grade level. We have community health workers and chaplains and care specialists that are going into the homes, including in Northern Arizona, because we're not only in Arizona, but we're also in Texas and in Tennessee. So we have a whole team that's an extension of that practice that can help with a lot of those barriers, which it could be transportation, which could be education, adherence to medication. And so that is something unique that Equality Health is doing.
I'd like to say just one thing to this, Jason from ADDPC. Speaking about different accessibility issues, like people that don't use technology, or sometimes people do use technology, like these screen readers or special programs. Like I use a speech to text program because I can't type on the computer, but I can talk just fine. So I use that program, and sometimes that program is not accessible for other, it doesn't interface with other programs. So that can be difficult as well. So just to be able to navigate those, have a digital navigator to help navigate those systems that people, for people that can't really do that, is important as well. So that's just a comment that I would like to include there.
And that's a great contribution. And we're very fortunate because now many of the things that I mentioned, even though we've fortunately moved beyond demonstrating it's a good idea, but the time of the digital navigators and digital health navigators is soon to be a billable service. And that's important. And many of the things that we started out doing at a distance, like diabetes care, if people, the education is part of the treatment, and people do want to stay in their own communities opposed to driving an hour for a diabetes class. But if people complete those 6 weeks of classes through the American Diabetes Association, it can be billed. So to create an environment and a place where people can have access to those things with hosted by a community health worker or their local promoter makes it easier for people, and it's billable.
Can I ask a quick question before we?
Absolutely.
So we use community health workers as well, and some of these other imprimatorios. You mentioned 3 different sort of permutations of that. And I think the comment on the billability of it is really key. Mm-hmm. So either there needs to be a code for it or some other payment mechanism, or it needs to be approved as a benefit on, say, a health plan. That's really key to getting those type of services out there. And I think a path to get there is standardization of those roles. So right now, I know with community health workers, the qualifications for that, the training, the certification vary state to state. That's going to inhibit being able to pay for those services or making it a benefit because it's not consistent across the country. So I don't know if you have any thoughts or experience about how we might standardize those roles, because I think that would move us in the right direction.
That's a hot topic nationally.
Mhm.
And CHW1 and CHW2 would be the credentialing that they need for it to be billable. And their training is all very different. And, you know, the IHS it really started the CHR program in 1964. ASCHOW, the Arizona Community Health Outreach Workers, are a 501c3, and they have their own rules and regulations with regards to their trainings and the way they acquire their trainings. And their promotores, you know, they're very proud of all the certificates that they earn, but you're right, to make it billable. And there's a California Center for Policy and Telehealth, and there are a lot of people who are, that is a hot topic nationally right now. How can we standardize it? And I want that code to be Digital Health Navigator. I would love to brand that code, because these are the people who've done the work that I know. I've been working with them for 25 years. We used to have huge suitcases of stuff. And now, you know, it's a small backpack and you can be at home doing your own remote patient monitoring. So a lot more is billable. It's wonderful. And we are beyond making sure that we demonstrate it's a great idea. It is a great idea, but for it to be successful, it has to be billable.
Can I piggyback on that? Andrew brought up a really good point, and I think a good starting point for having consistency, not only in Arizona, but nationally, is the use of Z codes. Working with our providers in promoting the utilization of Z codes when they do screenings, when they have the patient in front of them. I know that sometimes it's not available service now, but if we start using those Z codes to start collecting data and tracking, the most important part, I think, why we're all here is because we want to make something sustainable, right? So that's a good starting point, working with our providers, promoting the use of Z codes so they can start tracking them. I know for United, that's like a long-term goal down the road, because we're right now in the launch state, but hopefully sometime in the future, they will be able to track Z codes based on the referrals that are being made on the community cares platform.
I think that's a step in the right direction for sure. I some experience with Z codes, and one of the problems with them is that they're not specific or granular enough. And so, yes, we should use them. We also need to make them better. We need to advocate for more specific codes, because I think when they were written, you know, 20, 30 years ago, it talked about food and water and things like that. But we need specific definitions for food insecurity, transportation insecurity. Was it screened? Was it addressed? And I think we're beginning to get that in the quality space. So NCQA has a new HEDIS measure that's going to come, that's out this year. It'll be, I think, rewardable next year. And it is about screening and intervening for 3 particular social needs. So food, housing, and transportation. And it does specify Z codes, but also CPT codes, because you've got to actually do the screening and then you make the diagnosis. So there's a combination of codes that can be involved in those things, but agree, it's a right step.
I want to add that we have already started that process at Equality Health. We know how important those Z codes are. So we have actually created a training to provide the training to providers on Z codes. Who does it at the office? What does the Z codes mean? Where, you know, we give them all that information, but it starts with.
So we've actually, we have our own health access survey, which has been validated by the University of Arizona. And we actually put it on the community cares platform, and that's what we use. And that is tied to Z codes. And that's how we track it. And like I said, that's how our care teams use it. And we're able to track that information that way.
That's fantastic. I mean, I think you've got to put it in the infrastructure of how we do healthcare. And so if you're tying the code to a screening, that's the way we get people to do it. And I think some of the electronic health records, like Epic, has a module for social needs that has standardized questions and links to codes as well. But that's awesome that y'all are doing.
So we have it all in one place. We use community cares. We are able to screen them, track the Z codes, and then make the referrals.
That's great.
Real quick, just because I know there's a lot of transportation providers myself. Who wants to give a quick rundown of what a Z code is? Because it seems awfully important.
So it's it's a group of codes within the broader set of ICD-10 codes. So medical diagnoses for everything from diabetes to cancer. There are a set of what they call Z codes that are more specific to social needs. So they talk about food, water, transportation, housing, people who are at risk of violence, different things like that. Feel free to fill in the gaps that
the Z codes are attached to revenue for that provider. So if I go and see a provider and they see me for a broken arm, they bill a code for that procedure that they treated me with. And so they get paid that way. So that's a fee for service model. It is changing in the healthcare, and I know that value-based care, a lot of you know about it, but for those of you who are not in the medical, it basically now what's going to happen is providers are going to get paid to see Maria, whether they see her or not. They're going to get a monthly fee, and whether they see me or not. However, if they don't take care of my diabetes, if I don't go in for my wellness visits, if my kids don't go in for their immunizations, they might have to pay some of that money. So there's a risk. So right now with our partners, our network of providers at Equality Health is taking that risk, not the provider. And so that's why we do a lot of training. We have over 50 trainings that are available to our providers from phone etiquette. Because revenue for our providers can be by a survey that they got. It could be attached to that survey that the patient said, oh, the person at the front office was awful. The office was, not clean. And they never say how great the provider was at monitoring their diabetes. So there's a lot of things that are tied to revenue, and C codes are tied to revenue. I'm trying to use it in simple words that maybe somebody not in the medical field can understand. Is there anything else that you want to add?
I know, Maria, you focus a lot on the providers because that's your bread and butter. But I work more with the community-based organizations, and these are some of these trainings are also offered to our community-based organizations. And we do look out to make those community partnerships because we do have over 300,000 lives here in Arizona that we help our providers with. So we look to make those partnerships and see where we can connect and address those health related associated needs. So the SDOH portion to help them be successful and connect our members with those resources. And then at the end, it's also helping the providers and the health plan. So we try to encompass it from a different.
And I would just add that those codes, I think someone mentioned this, is that they have to be they're evergreen. We need to evolve them so to include social services. So a lot of it is very medical based, and reimbursement it's dependent on those codes. But a lot of that is not inclusive of community and social services. So those are the kind of things I think if we adapt the nomenclature, that will really just underpin our resolve for social determinants of health.
I know that Access has a list of the Z codes that they recognize, so I can send that to the group. One of the other things that we want to get to at long term when as a health plan is that my personal goal is integrate the CBOs. And just like Maria was mentioning, when a doctor bills for a doctor visit, I want to make sure that if a CBO is providing, let's say, food boxes, that I can pay that CBO for that food box because they're meeting a social determinant of health. Or if someone is getting transportation, I would love to get to the point where, hey, you provided transportation, we're going to pay you for that. Or if someone who's providing financial assistance, we're going to pay you. We got to come up with the formula. I'm not saying that we're there yet, but I think the long-term goal is going to be able to work with those community-based organizations, identify whatever formula is for the services that they provide, and the health plan can pay them in return for providing those services. Yeah. I know it's a long-term goal, but it's something that I think it's doable. It's going to take a lot of work. And it's going to take a lot of education on the CBO side because they're just used to providing whatever services they provide, whether it's food boxes, financial assistance, whatever it is, they're working off of grants. So the introduction into the healthcare system is probably our responsibility to educate them. We don't want them to become experts on Z codes because that's not what they do. but we do have to make it easier for them, where if they're already providing SDOH service or program so that they can get reimbursed for that.
I think you're absolutely.
And if
sorry,
I
go.
can just add real quick, because you're right, Mauricio, it's long-term, but something that's not long-term is the fact that if we partner up with our CBOs, and she can talk more about it because she runs that program, is the fact that now they have access to data by partnering up with us and partnering up with Unite Us. They have data that they can actually use to show in their grants the difference that they're making in the community and the people that they serve and how they're keeping them healthy. So that is not long-term. That can be done now. And you help them with the reporting and all that. Correct?
Yes, we do that. And then we also do that with our care teams. And that's why I always tell our care teams, even if the CBO is not in what would be considered in network in the Unite Us platform, I say track it there, because they can do out of network referrals. And that gives us the ammunition to go to that specific CBO and say, hey, how can we partner? Or, you know, when it comes to you asking for X amount of dollars for a grant or whatever, this is what we can show. And that helps build, you know, for the money, for the partnerships and all those additional resources that we need to make or help our community be more successful.
Yeah, I totally agree. And I think that the payment mechanism creates sustainability. Because a risk of these digital closed loop platforms, and not a criticism by any means, but they're super effective at creating demand for CBO resources, right? They aggregate all the CBOs, make it really easy to refer them in, but they're not necessarily inherently creating capacity for the CBOs. And that's where the payment has to come. So either we have to figure out how a health plan, in our case, can pay directly the CBO for a service that was delivered to our member, or a different value proposition, which is what you were describing, and saying, okay, well, there's data now. So we can give data back to that CBO so that they can be in a better position to apply for the next grant to self-sustain and fund their own organization. So totally agree.
And I think to Andrew or Dr. Renda's point, I'm Chris Hansen, by the way. I'm glad I was able to join. I thought I would be a little bit later, so this is great with Humana. To Andrew's point, there are a lot of flexibilities at the health plan, just figuring out the right approach. Now that you have the data and you have the quality outcomes, that impacts we have flexibility in our quality-based reimbursement. So it's a quality-based activity that a lot of the CBOs are doing. But again, it's just figuring out what's the first step, you know, to build certain uniform programs across the board that would address some sort of sustainability through reimbursement at that quality level. So, and I know that there's some great organizations in here like Equality Health and others that, you know, I'm sure if we put our heads together, we could start working in that direction now.
Great. And Chris, I'm not sure if there was an extended or any additional items from Humana's standpoint that you wanted to touch on.
Oh, I'm sorry, Chris, is your mic on? Thank you.
I do now. Did I not have it on a minute ago? No, I'm just gonna listen in and join in as the conversation continues.
Absolutely. And just for the group at large, is there any kind of questions with any of the presentations we heard from the lightning round, or if there's any other organizations that would like to provide a quick update? I just, from a timing standpoint, I understand that lunch will be a little bit later at 11:30. And so we do have a little bit of additional time here. But I do think as part of the day is that we do want to introduce kind of what we're hoping to accomplish this afternoon before lunch, so we can kind of talk it over, think it over as we're eating our sandwiches. But I do want to hold real quick on these lightning round or any of the information we've heard so far. Is there any other comments or any other questions?
I just want to make a comment. For those of you who are watching us online and listening to us online, I just want to recommend that the next time they try and make it in person, because it is so valuable to see the people here and have these intimate conversations. So just for the next time.
We tried bribing them with sandwiches with the free lunch. So
It's transportation.
It's transportation. Well, great. Well, I think Hezekiah, if you wouldn't mind popping on to, we could take a break, or we could try to kind of run through this next bit and then have an extended lunch. Does that sound fair to the group? I know it's been a long morning and we kind of blew right through a lot of the time breaks, but I think this can be relatively brief. Again, what we're hoping to do this afternoon, I think that we have that next slide does have the kind of breakout of the topics, or even keep going. Sorry. Here we go. This is for the afternoon. Is we do think that, again, we have these kind of general themes we've identified, but I absolutely want to allow an opportunity if there's additional topics that we would want to cover. But we do have sort of a running start on a communication platform concept that's intended to improve communication between healthcare providers and transportation providers. I think that the starting point here is definitely focused around kind of very tactical items like appointment scheduling and appointment cancellations. But I also think that what we've heard from some of our providers today is that's a huge piece. I think Kent mentioned that 20% of appointments are often canceled. And so again, that's an inefficiency that's there, that we think that finding platforms, utilizing a platform to improve that communication with transportation and healthcare could really have a profound impact. And I also think that there's a lot of opportunity for that to expand upon and be integrated with some of the other initiatives that we hear that are taking place from around the state. And so, Amy, real quick on the communication platform, is there anything else you'd like to add on that, just as a quick rundown?
Great, thank you. So with the communication platform, the work for that really started from the realization that often the number one ride that's requested is for medical care. And then we started talking with some of our stakeholders like Kent with Verde Valley Caregivers, and then realizing that like almost about 20% of appointments are canceled or moved, but there are many patients who can track that themselves. And if so, great, but not all can for a variety of reasons. And so about 20% of the time, you'll have a volunteer driver taking a patient to an appointment that they think that they have. They arrive at that appointment and then they don't have it. It's either been canceled, it's been moved, it's been changed to telemedicine. And for whatever reason, that older adult was not aware of that change. And as a result, could not then let the transportation provider, who's typically a nonprofit agency using volunteer drivers. And so it's a strain for the transportation agency, for that nonprofit, because then they have a volunteer who's driving somebody to an appointment that just doesn't exist. So it's not a good use of resources. It's also tough on the medical provider because then the person, if they went to one appointment that wasn't happening, then they're probably missing the appointment that was supposed to happen. And so, so then they aren't able to provide care in the way that they need to. And it's absolutely a problem for the older adult who then doesn't have who then doesn't have the medical appointment and may not get transportation to the next one. And so we focus in on that. And in particular, how can we use technology differently to address that issue? Again, we know that there are some really good efforts already underway, but we realize that there's still an opportunity to do more in that space. And so we started working with the Cloud Innovation Center, and that's a partnership between Amazon Web Services and Arizona State University. They have cloud innovation centers all over the world. We're fortunate enough to have one here at ASU. And so we've been working with them about how do we put together some kind of communication platform so that then the transportation provider can be in direct communication with the healthcare provider, which doesn't always happen necessarily. And so we've been designing what this communication platform might look like. And then we started reaching out to tech partners like Unite Us and realized, okay, wait, they've already got this great platform. And in our desired functionality at full build out, it would have included being able to make referrals and things like that. Unite Us already has that. And so we're talking with them to explore the idea of could their existing platform that's already in use, could this serve as a communication platform that we've been talking about for a while? And so if you're interested in that conversation, please do join us. Vince, I hope you'll be in that session. And Arun, you as well. Arun has been helping us out from the cloud innovation side of this, but really explore. So with these next steps, it's not necessarily designing a new technology. It's how do we better utilize an existing technology, maybe in a different way, and maybe bringing different partners to the table. And so we're looking at this rolling out in a couple different phases. One is a demonstration phase. So Ken from Verde Valley Caregivers has been gracious enough to already commit. We're in conversations with the healthcare provider. Again, two partners. So if you think of partners, we need the transportation provider and then the healthcare provider. And there's room for other partners certainly in this mix, but to have a demonstration phase just to kind of test drive this idea. Does this idea work? Is this idea meeting an important need that's not otherwise being met, or maybe not being met as efficiently as it could be? And then a pilot project phase where we hope that you'll all join in as well, where we roll this out with a larger group of folks, and then full production, and hopefully being able to implement this statewide. So again, Unite Us is uniquely positioned because they're already working statewide, and they're already working with a lot of the partners that we would want to engage in this. But we want to be able to consider if there are additional partners that we could bring to the table, what role might they serve in, and then how can we figure this out together, basically. So that's the idea right now for the communication platform. And if you're interested in that, please do let us know. We'd love to have you join us. Just a note too, we are able to record each of these breakout sessions. So if, for example, you're wanting to go to communication platform and telemedicine, then you'll at least be able to view the recording of that session after the meeting. And so we want to be sure to engage you in as many different ways as possible. So just wanted to offer that. And then we'll have each of the other sessions kind of give a commercial, a brief overview of what they'll be discussing in that session. So then you have an opportunity to decide which session you would most like to attend right now to join in on that conversation, and keeping in mind that you'll be able to view the recordings of those sessions afterwards. Any questions, anything else to add about the communication platform? Vince, Arun, is there anything that you'd add from your perspective?
What was that for me, Amy?
Yes, Arun, is there anything that you'd like to add about the development of the communication platform or the project surrounding that?
No, I think you summarized it pretty well for now. I'm sure we'll get into details later, but for now, you are right on the mark. Thank you.
Thank you. Vince, is there anything that you'd like to add?
No, Amy, you did fantastic. I just also want to give a shout out to Equality Health because they're one of our main kind of onboarded organizations. And so I'm interested to get into this conversation with that session to look at what this looks like from an interface and interoperability for different layers of organizations.
Thank you very much, Vince. And it is really important that we speak with the existing partners, but particularly new partners in this, or people who might be partners in this, because every time that a new person comes into this conversation, we have a deeper understanding of something that we have not thought of before. So it's really important that if you're interested in this, please do join in. And if you'd like to have a debrief or a separate meeting after today's session, then please do let us know, and we'd be more than happy to get that scheduled with you. Thank you. Todd?
Just one quick note. For the afternoon, we do recognize that there's a lot of shared interest in probably multiple categories, multiple topics. And so the way the afternoon is broken up is there will be kind of two different sessions where we're kind of sort of musical rooms, potentially. If you did want to be in the communication platform conversation initially and then transition to the telemedicine, we're kind of setting that up as two different sessions there. So, but to continue along the other topics that we're going to have there is that Healthcare and Transportation Taskforce. And I think that understandably, this is a very broad-based topic. I think that we kind of are just recognizing there's a need to set up some sort of a kind of an ongoing conversation that I think that the conversation we had earlier, I mean, that's all I was going through my mind is like, well, this is a Healthcare Transportation Task Force conversation. But kind of just a platform, a venue to host those types of conversations. And what that looks like potentially moving beyond the summit is potentially, an ongoing piece that could be kind of sponsored or developed in collaboration with some of the government entities that we work with. So, and then the telemedicine piece, I think, kind of speaks for itself. And I think that's one I know I'm particularly interested in. And so I'll be kind of helping to facilitate that. I think that there's an awful lot going on in that space. And so trying to figure out what types of gaps there are within the current infrastructure, what new opportunities, new communities that could expand to, what are some of the kind of additional supports, broadband being one of them. I know we've had conversations around. So anyway, that's kind of the trend for the afternoon. We do want to also recognize that if there's any topics that we're not including here, that we don't think would fit in the necessarily in transportation healthcare task force, perhaps like another type of pilot project, we absolutely want to, we have a room for it. So if there's any other topics that anybody from the group would want to introduce, I think we'd be very open to that as well. Sorry.
Could I ask one quick question?
Oh,
Sorry.
go ahead.
For the folks who are online, right, how is this breakout rooms going to work? Maybe I missed the logistics of how are we going to participate in that?
Thanks, Arun. So I'm looking at Hezekiah. I think we'll have the breakout rooms. Hezekiah, do you want to?
Yes, so we're going to open the breakout rooms. You're going to receive a prompt on your screen, on your Zoom screen, asking you to join each one of them, and they're going to be labeled according to what you see on your screen right now. And then you'll be able to join. Our physical rooms in here are also going to be separate, and they all will have one room, one connection to the Zoom as well. So you will be able to join the conversation there as well, the same way that you're connecting here right now.
Thank you, Hezekiah. And special thanks to Hezekiah. He's been our tech leader in all of this in terms of staffing the meeting. So thank you for making that possible. And just a note too, the Cottonwood room is all the way down this hallway out the right side of the door, this way. It's all the way down at the hallway. Choya room is just before that, and Chaparral is just right here as well. So if you're in person going to any of these breakout sessions, just go out the right side and go down the hallway. You'll see each of the rooms in turn: Chaparral, then Choya, then Cottonwood. Are there any ideas that you'd like to think about in terms of the Juniper room? So are there other additional ideas besides these three that you'd like to explore with other possible folks here?
I'd like to bring something up if you don't mind.
Please do. Is that Sam?
Yeah, hi, from Elaine. So one of the things we've actually been looking at is heat relief rides, which I realize is a little bit tangential to the overall topic today of healthcare transportation, but it does have an incredible effect on people's health outcomes. So I don't know if that's something other people here would be interested in, but just basically how to connect people to the existing cooling centers and existing hydration centers that they don't currently have access to.
No, thanks, Sam. That's absolutely a critical need. Looking around the room, and if folks online are interested, please do feel free to jump in. Heat relief rides. Okay. Sam, we'd love to follow up with you maybe offline. We have a regional heat relief network, and it'd be really good just to make sure that we're working very closely with you on that and able to address any other needs. So someone from our human services team will reach out to you. But thank you for raising that today. Important.
Okay. So it's 11:20. I do think that we want to hand the mic over to Eric really quickly to introduce the sort of the flow of those workshops this afternoon, and then hopefully lunch will be kind of provided, and we're hoping to have this sort of a informal networking lunch, talk about which topics that you potentially want to go to, and then we'll kind of meet up in those rooms afterwards. But to help kind of give you something to mull over as you eat your lunch, Eric, we want to introduce the workshops this afternoon.
All right. So as you can see, there's kind of those breakout rooms. Feel free to pick them for at least the first one. There's also going to be a guiding document that I'll hand out, which is really just kind of the framework of things to think about for each of these sessions. Since they're all relatively unique, break it down, follow the path use the framework for the conversation, tailor it to your needs, kind of just use it as a guiding document. It may or may not fit all of the nuances of each of those projects, but you'll have a facilitator, one of us in each of your rooms, to kind of capture those notes and really help the workshop flow a little bit. But then at 1 o'clock, roughly 1 o'clock, we'll break, where you'll have the opportunity to go to that second room if you so wish to explore another topic or continue the deep dive in your first room. And then after that, around 2:20 or so, we'll kind of reconvene, where we'll kind of discuss each of the rooms that you were in with a little conceptualized high level, just kind of what you came to for each of your groups, so that we can share with the rest of the room. Of course, it'll be recorded if you want to watch it later, but that'd just be a high level 5-10 minute just kind of presentation from each of your groups. So something to think about as we conclude the day before 3 o'clock. So with that, we'll take a much needed break. We'll go to lunch, which I think is here soon. And then you can find your rooms for 12 o'clock.
Excellent. Thank you. Just a quick update for folks. Lunch will be ready in about 5 minutes. So if you want to just network with each other, if you need a bio break, again, women's restrooms are out the left door, men's restrooms are out the right door, past the elevators. And we'll be, well, when we open the doors, that's when it's time for lunch. And please feel free to come on in and grab something to eat. Thank you.
Right. And we'll look to reconvene around noon. So thank you. I think that, we all recognize that rush hour here is no joke. And so I definitely want to make sure we get out of here by 2. Maybe I'm saying that selfishly, but what I do think that we had for the kind of remainder of the meeting was we did want to hear from, some of the breakout groups, just kind of a really quick rundown presentation on what was discussed, but then also kind of turning to day 3 for this summit. One, seeing if this group's also interested in coming back around and kind of continuing along these conversations. And then also, is there kind of guidance or recommendations that we can have as sort of a planning team to help, make the best use of that final day of discussions around some of these various topics. So with that, I think we'll start with a report out from what we heard. And I think, Mauricio, were you kind of appointed the spokesperson for the Transportation and Healthcare Task Force?
Kind of, sort of, yes.
Okay.
Well, I was very happy to be part of that group. It's obviously being a health plan. Our group came up with a lot of really good ideas. We identify and we recognize that the CBOs, or community-based organizations, nonprofits, however you refer to them, really play a key role in this whole transportation and social determinants of health. So I think it's our job as health plans and other entities to, how do we support them? Because they're already doing great work out in the community. But as we know, they have huge challenges when it comes to staffing, when it comes to funding. Many of them have volunteers. So we kind of want to meet them where they're at. And as health plans, how do we invest money that's going to be like a win-win situation for everybody? I know that there's already some sponsorships that are taking place. There might be some value-based contracting. But I think in order for everyone to benefit, providing some of that technical assistance, grant writing opportunities, maybe helping with some administrative roles for the CBOs is really a valuable service, because as we know, those CBOs mainly operate on grant funding, but they don't have like the additional resources or bandwidth to write a really good grant that could really bring in some additional funding that's needed. So just focusing on them and how do we bring them up? How do we become that bridge to the healthcare system? And as far as the healthcare providers go, a lot of interest on Z code so they could start billing for those transportation services. And how do we make that process easier to implement in the work that they do every day? One of the things that we did identify, and most of the health plans already contract with a transportation provider, transportation broker, but through our experience and through conversations with the group, we find that the nonprofit organizations that are providing those transportation services are better trained to serve the specific populations rather than to get a random, I'm not taking this away from what already exists, but we already know it's kind of not working.
Yeah.
So like if you get an Uber driver or a taxi driver that's picking you up to go to an appointment, they may not have the necessary training or the compassion, empathy, or the patience to deal with the populations that we're talking about. So how do we learn from their best practices and models that the CBO or those nonprofit organizations are providing? And a lot of the training of the personnel. How do we take those models that are already working, like Elaine seems like a really good model. The Verde Valley caregivers have a really good model. And how do we kind of build from that and roll it out into other parts of Arizona that maybe could use that as a template to maybe roll out a program? And as far as the coalition, just identifying who the key players should be, how frequent do we want to meet, the expectations, if we're going to be part of a work group or task force, what are the expectations and what are our goals? And I'm sure I'm leaving a lot of stuff out because we had stickies all over the screen.
Yeah, I imagine you would with that.
And I'm
category.
sure the other groups did as well. So that was kind of like a major high level overview of what we talked.
And so I guess I'm just curious to follow up on, some of the potential supports to the community-based organizations from an admin roles perspective. I think you mentioned grant writing as a piece of that, but was there a deeper conversation on
We
that?
talked about maybe, and I know that this has been done with other CBOs, like from the nonprofit world. We want to just let the CBOs do what they do best and maybe have like an umbrella organization over them, kind of like takes some of the administrative grant writing. I don't want to call it burden for CBOs, but sometimes it could really be a burden because of lack of bandwidth. I think a lot of the CBOs learn that there's a lot of funding and opportunities. There's a lot of resources out there, but they just don't have the knowledge or maybe the staff to be able to go out after those funds that they probably would qualify for. So maybe having like an entity that can take on that role or the administrative role, or sometimes it could be the reporting, because some CBOs may not have the database or the technology that's needed to track a lot of the outcomes that we're looking for.
Sure, the data piece.
And as far as the health plans go, we can also help them in maybe do a white paper once we start collecting that data and measuring the outcomes, so we can share that with the CBOs and they can use that to leverage for additional funding. So create some type of white paper that's measuring outcomes on how transportation plays a big role in reducing healthcare costs, maybe utilization of the ED, something that we can measure and do a white paper on that we can share with the group. We kind of talked about things like that.
And so I'm curious from the group's perspective, anybody else that participated in that, was there any kind of conversations around day 3 and this kind of summit and ways that you'd like to see that position?
We didn't
to
really
support
talk
this?
too much about day 3. One of the other ideas that came up during the group, I know that the Access Health Plans here in Arizona, they formed a kind of like a consortium of all the Access Health Plans where they focus solely on housing. And each one of the health plans pledged to do X amount of funding per year that goes specifically towards housing. How that money gets distributed and all that's decided by a committee that's leading that effort.
Mhm.
But I don't know if there's something that could be focused on transportation that could be similar, where some of the health plans, whether they're access or maybe not access, that want to kind of be part of that process, kind of pledge funding towards transportation initiatives or efforts that are happening throughout the state. That could be a conversation that maybe could be had. I don't know. I know that's a lot, but I don't know what, as far as day 3 goes, I don't know how we put all that together.
Sure. And maybe
We
it's
didn't
not.
only get to day 3 because we're still working on day 2 and stuff, but still, but like Mauricio said, we did talk about, also you mentioned the data piece, but we also talked about kind of centralizing a data piece so that everybody can use it for the white paper, because sometimes there's barriers around getting data from healthcare organizations. So we talked about making it some sort of utility to make sure that we could all use that data, in a way that we could use for grants and all those kinds of things.
Sure.
So and we talked about how, then we just got into who we want to lead the group and, all that kind of stuff. And we talked about those little minor details and bylaws. And anyway, but yeah, we didn't get too much into day 3, but
That's okay.
Mauricio did a good job of breaking it down. So that's good.
Thanks for your support.
Okay. Yeah. Okay. That's perfect. Perfect. Great. Is there any kind of questions or comments from the group on the Healthcare Transportation Task Force piece? I think so. I think we do. It's mainly for the people online. So yes, I think we do need that.
I think sometimes data that's overlooked is green data and the number of miles people would have driven for services if they had to get them, or the number of miles they saved by getting services someplace else. That's all good data. And then what billing codes are people using? Which of these transportation encounters have been reimbursed and by who? We talked about other entities that have like a small portion of transportation. Anything, if someone's transported from point A to point B, was any of that covered by anybody anywhere? And how many miles was it? Would be great data.
Sure. So kind of standardizing the data collection and reporting
The numbers
component of that, which is, I think, a major thing in the transportation world that we've ongoing challenges trying to do that. But I think that's a great opportunity, and that a lot of them are collecting it in one way or the other. So, well, great. Anything else on the healthcare task force conversation? Okay. I guess I will do my best to talk about the telemedicine conversation in the chaparral room. Hezekiah, I'm not sure if you can pull up the chart. It's probably going to be really wonky because I'm going to be telling you to go up, down, left, right. But we had a pretty wide ranging conversation. I think that the bottom line in the telemedicine, from my perspective, and from the group, please feel free to jump in there. But it just seemed like there's an awful lot of things in motion. And so I think if I were to summarize maybe the conversations that we had, it's centered around trying to find a way to kind of package telemedicine with mobile healthcare, Yep. As well as kind of factoring in the digital and healthcare navigators. And so kind of this idea and the concept of, potentially we could have the libraries kind of as these hubs that are set up, that we would, continue to work on all the efforts that are already ongoing to make every library in Arizona, outfitted as a telemedicine hub, have that opportunity. Also recognizing that I think we pulled up one of the maps and showed that there's libraries, in a lot of places, but they're not covering everywhere. There's definitely a lot of pockets of Arizona that would still need an additional way for healthcare to be brought to them. And so we think that that's kind of trying to carve out a niche for these mobile clinics, to somehow fit in there, and maybe work in coordination with the libraries. We didn't quite necessarily get drill that down necessarily on what that would specifically look like, but we see there's a need there and a role there. Some great examples that are from around the state that we found, North Country Healthcare up in the Flagstaff area. They kind of outfitted their mobile clinic. I know that the Tuba City Regional Healthcare also has some plans in motion to just deploy a mobile clinic. And so kind of factoring in that's also a sort of level of service that we'd like to provide. And then lastly is the digital navigators, or the digital healthcare navigators, and kind of, trying to, if I had the map there, for the rural areas that wouldn't necessarily be addressed with either the mobile clinic or the hospitals, but kind of on that more personalized level, somehow finding an ability to bring these digital healthcare navigators that could be showing up at people's homes. So again, thinking instead of, in my way of thinking about things, instead of picking that person up and taking him to Phoenix, we're just driving out there and handing him a tablet. Maybe there's a chance that the tablet actually is already connected with the healthcare navigator, or maybe there's a role there to somehow integrate all those different pieces, but factor in our transportation providers in that capacity in some way. And so I think that we talked a lot of different ways about how the digital navigators could be played out. I think that Aaron mentioned, kind of a vision potentially could be looking at having regional digital navigators. So maybe it's kind of helps divide up the state, because right now there are There are digital navigators, but they're only available virtually. And so having the kind of the in-person boots on the ground supports for some of the pockets of Arizona could kind of be factored in. So that's kind of it was a very high level conversation. I think a lot around a lot of different pieces. It sounds similar a little bit to the healthcare task force conversation. But there does seem to be a lot of pieces out there that I think that there's maybe with a little bit more time and maybe a little bit more structure based off kind of this sea of information that we kind of took in today. I think there could really be some real practical kind of pilots to come out of that. I don't think we have one developed quite yet, but I think that there's definitely some opportunities there. So I don't know, from my group or from those who attended my work session, is there anything that I missed there? Anything you'd like to add to that? Perfect. Okay.
Identifying that, like for reporting, what are the major funding sources that are going into all of this? And if we can identify those, then, you know, maybe we can have a better solution to building that pathway to sustainability. So funding.
Yeah.
Long story short, funding. How are we going to fund all of this so that you're not out there constantly having to grab those grants?
Sure. Yeah, absolutely. That's a great point, because I do think it sounds like there's a lot of funding for hardware. There's not a whole lot of funding for staff time to go out and actually serve in the digital navigator role. And so kind of trying to piece that together, you know, I think that could be some opportunities to get very creative on how you look at, you know, kind of a hodgepodge of funding to support that. But I think it's all things that are worth kind of digging into a little bit more. Yeah, Jen.
I think one of the big successes of our telemedicine program, and I really think of myself as being a digital navigator 25 years ago, I've always been teaching technology to people. But I started out being 0.10 FTEs of the Arizona telemedicine program. And then after another year, maybe I was 0.25 FTEs. And then it grew into 0.5. And then that grew into a full-time job, because there are a lot of grants out there that cover the technology and the telecommunications connectivity. But when you think about partners and sustainability and who's going to do the work to make this happen, it really might be a matter of different organizations stepping up and saying, I will give you 0.15 of FTE of this person.
Sure.
You know, I will give you 10 hours a week of one of my staff members to help you make this happen, because we really believe in your project.
And I think that's one of the things that I was curious about, roles for the council, the COGs around the state to play, especially from the regional perspective. I think that there's some definite funding challenges there, but I think that taking that same model and broadcasting it to a wider partner network could definitely be a great maybe role for kind of this coalition or this summit to work towards. So.
And it even worked with specialty care. You know, we wanted to be able to demonstrate. And again, back in the day, we wanted to demonstrate if there was a need for rheumatologists. There's 2 rheumatologists in the whole state of Arizona. So rheumatology, cardiology, dermatology, different key providers were identified, and they were each given a stipend of $25,000 a year. So whether we would force billing, we put everything through, and either it was paid or not, but whether the bill was paid or not by the healthcare provider, that doctor was being paid, because we bought 0.25 of we bought $25,000 worth of their time.
Interesting.
You know, and I think no matter what your role is, there's a way that we could quantify how much time we could expect from each partner.
Sure.
As we move forward. I think it would be a good way to get the ball rolling.
Yeah. Coalition of Digital Navigator Funders. Any questions, comments on the kind of telemedicine work group? Again, I think for day 3, I do think we would benefit from another kind of structured session, building off what we learned, and I do think including some additional partners. Again, the Arizona Coalition of Community Healthcare. I think Janet made a comment about how we shouldn't even be talking about this without them in the room. So we'll include them next.
Yeah, I think we've had some successful initiatives by including the faith-based community. Because there may be some communities maybe where they don't have a healthcare provider or a library, but they do have a church. And I think the faith-based community, they obviously have a location. So a location can be utilized to bring a mobile unit maybe. They have volunteers that could, with the proper training, maybe they can assist in some of the initiatives that we're wanting to roll out. And they can also help us promote and just get the word out as far as whatever initiative we can come up with. And I find that the healthcare community is always willing to help, but they need a little bit more help with some of the training and maybe implementing information and resources for their volunteers to kind of follow through on. So it might be a good alternative to those areas where they might not be hospitals or libraries. There might be a local church that might want to get involved in some.
Great. We also talked just high level about partnering with Dollar Generals, which I really like the idea of looking at partnerships with Dollar Generals and having them kind of be outfitted as a quasi healthcare service. So I think that's pretty neat. Okay. Well, so Amy is unfortunately not here, but for the healthcare and transportation communication piece, I'm not sure, Hezekiah, I do think I might need this one because we'll have to look at her notes, but is there anybody that did participate in any of those conversations that would want to kind of get us started on just the direction that those conversations took with the healthcare communication or transportation healthcare communication platform?
What's interesting because the churches came up as well as being an important community member in a place where is a hub for folks.
So I think Amy did pop through and just kind of highlighted some of the key notes there. So in terms of the problem statement, because of missed appointments, we have the opportunity to dispatch more efficiently and integrate more with other systems. So I think that's fundamental to everything we've talked about, is just the degree of demand that's coming, or that we're expecting to continue to see.
And then the food banks and Arizona Cooperative Extension Services in every county are also good folks to communicate with and work with in terms of improving the efficiency of how we provide travel by reaching people by where they go.
And so I'm not sure if in this group, if Amy did kind of mention, or if Arun is in the, maybe he's probably not, still on the call, but some of the work that they've already been doing in terms of the software piece that they are developing and on how the communication could work between healthcare providers and transportation providers around missed appointments and whatnot. But I do think there's a question here around, how are we making sure that that's not duplicating any efforts that are already going on? And so is there anybody else that's already doing this? And so I think that's where the conversation potentially with Unite Us popped in. So Arun, I'm not sure if you have any other kind of comments so far.
No, I think our proof of concept started with mobilizing this whole conversation, right? How do we bring these parties together? The healthcare providers, notifying their change in appointments. Today, there's a lot of drop in the ball. So a lot of wasted resources, and that's how we set out to achieve. But I think then later we found out partners who have much more greater capabilities than just the problem we were trying to solve, like with the medical appointments. It is much more than that, with the referrals and the social determinants of health, and all of that is going to come along with a platform provider like that, which excited us, right? So now the question here we talked about towards the end of that call was, hey, we know enough. We have the right kind of platform as well. Now we should go really put it out there, experiment, test, and learn from the ground, and try to move on from there. So that's where we ended up with.
Great, thank you. And I think that we mentioned before that initiative is kind of looking to kick off with Verde Valley Caregivers, who heard from Kent earlier, and in a partnership with Northern Arizona Healthcare, which I do think for some of the other transportation providers in the room or on the call, I know that a bulk of those trips that you guys are taking are also to Northern Arizona Healthcare. So that might be a really kind of unique scope, geographic scope to kind of focus in on, and then also try to identify if there's areas to replicate across the board. It did seem like, I do think Amy wanted to pull up, the supports to pay for the system.
I guess it's a software system is ultimately what this would be, was there did seem to be some real strong conversations around, again, those Z codes and the opportunities for those type of referrals, or that types of the fact that the healthcare actually being provided and streamlining that access. There could be some reimbursable pieces associated with that as well. So that's me. And I'm just trying to pop around. Would you go to the blue notes there? Here we go. I think this is to your point earlier, Janet, around just a wide variety of organizations that could also be involved in this. I think that that's a theme with transportation, is it impacts everybody. I think across the board, especially in rural regions, it really is touches on a wide variety of community-based organizations and other community partners. So I'm trying to think if there's anything maybe on the day 3 section, Hezekias, if you wouldn't mind. Yeah. Oh, this is to Arun's compliment. The best way to do is to go. And so I think that that's kind of very much where we're at with that Verde Valley Caregivers example. And but then I think that other sticky note there on how to evaluate the phases. How do we know if whether this is being successful or not? It seems to be a theme I've heard throughout all the sessions, is data. How do we track the data? How do we evaluate whether it's good data, meaningful data? And so I think that's a piece that can definitely, we can build upon that and try to figure out how to incorporate some of those data components into that, as well as I think in some of the broader pieces that Unite Us is trying to accomplish. And that seemed to be a major focus of Vince's presentation earlier, was that data component.
Yeah, the data, regarding the data component, right? The platform that we leverage itself should generate a lot of the data and analytics that we probably need out of that, right? As we do these in the proof of concepts and different pilots, it will give us some good insights based off of what comes out of that. And then we should be willing to alter, change, and modify and adapt as we go along. That's the whole point here, right?
Right. So is there any other questions or comments on the communication platform effort?
During our work group, we talked about coming up with some type of template as far as communications go, kind of like a toolkit that any partner can use with some of the talking points. If we create flyers, maybe some of the messaging that so we're all kind of, sharing the same message, maybe creating a toolkit once we come up with those focus initiatives. I know that recently we were talking about redetermination for the Medicaid population. They started disenrolling Medicaid members April 1st. And the Access itself and a lot of the health plans came up with their own communication toolkits to make sure there's like a unified message and raising awareness of what they need to do or where they need to go and provide those resources. So a toolkit might be something to consider.
Centered specifically around this communication platform?
Well, we talked about maybe whether we want to promote transportation and healthcare, how do we get the word out? Because I think one of the things that we found out through our meetings today is that some people talked about resources that they were not even aware of. So how do we have like a consistent message that we can share through your networks or through different organizations that you might approach, and having those key talking points so that we're all sharing the same information, regardless of whether it's transportation or other areas of focus.
Great. Thank you. I think that's definitely something that we can look to factor in here. Well, great. Well, so it is 2:45. I guess, is there any kind of final comments on, potentially looking at meeting together in some capacity in June? I think we're trying to be intentionally flexible with what dates and what that would actually look like. Is this something that we would want to try to get back to meeting in person? We did offer the first, session of this summit was virtual. And so that could be impactful. We were kind of hoping, obviously today was a little bit more of a work session. I definitely could see value in a continuation of sort of a work session platform. But I'm just kind of curious, just initial reactions from the group on if they'd like to try to meet together in person, or do you think we could accomplish what we want virtually? Or is there other members of
your organization that you think that you'd like to include, or if you're needing to step away? I guess I'm just kind of curious, initial reactions from the group.
I like both. I like the idea of keeping the communication flowing, but planning to get back together in June would be awesome.
Comments?
I second that.
Okay, I think was that Sam?
Yes.
Okay. I do want to allow N-CATT. I think that they're going to be drafting up sort of a summary of this, and I want to give you guys an opportunity to speak about that a little bit. How it fits into overall.
Yes. So what we will do is we'll put together a more, I guess you could say, formal kind of recap of everything that we've done so far. So then that way, we're especially able to outline next steps. So, one thing we really like to make sure of with all of our efforts is that all of these are not just everyone had a meeting and felt good about it, but something actually happens afterwards. And so this way there will be specific things that Todd and Amy will be able to follow up with you all on to actually take those next steps. And so it'll be written and you'll all be able to refer back to something for that. So depending on if the next session ends up being a work session as well, then we would just kind of have an interim item to lead into the next one. Or if we go back to that Shark Tank idea, then based on what we land on, it'll look slightly different, but ultimately it'll give you those next steps that we're looking for from this. And related Todd, information for you as well is we got an extension as N-CATT for another few months. So if we need some more time, if we want to do more work sessions and another meeting, or just if we need some more time to regroup and get things done in like July or something, then that's an option as well.
Gotcha. We're not necessarily tied as immediately as we thought to June, which we recognize was going to be a tight time frame. But so I do think in terms of next steps is we will be receiving this kind of summary because there's an awful lot of information we covered today. So some sort of kind of write up that's going to be provided from our N-CATT team. And then I do think that, we've made a lot of great connections here. And so our project team, I think we've been pretty active with a lot of you guys just following up and having conversations. And so I can see that as kind of some next initial steps as we look towards formulating whatever day 3 and whenever day 3 is going to take place, kind of based on after we sort of digest everything that we heard today. But I really do appreciate everyone coming and again, adding to the conversation. I think that I've learned an incredible amount in the last month and a half. So this adds to it. And so is there any other kind of final comments from the group before we? Okay, well, I think that's a day. That was quite a day. Thanks again for being here in person all day long, and maybe a special thanks to those that were on virtual that stayed with us all day. But again, really appreciate it, everybody. And I think there's some great connections made. And so we'll be in touch, and hopefully we'll get this same group and potentially even some additional stakeholders involved in some of these future conversations. So thank you.
Thanks for doing all that you do, folks.